Okay, thank you. We're back in session. Just for the public's awareness, we're going to be recessing our session today at 5 o'clock. So if we're not finished with any items at that time, they'll be continued to tomorrow's session. Obviously, we're going to do our best to get through everything that we can today. So with that, we're going to begin with item 25. We can begin with public comment on this item.
Thank you, Vice Chair Lawson-Remer. For item 25, we have 15 requests to speak on this item, 10 in person and 5 requesting to speak by phone. Also note for the record that we did not receive any e-comments on this item. Any members of the public that requested to speak on item 25 by phone, please dial into the conference line using the instructions that were provided to you. We'll begin with the in-person speakers, starting with those in favor of this item. As your name is called, please come forward and stand against the east wall under the murals until it is your turn to speak. I'll be calling the groups in favor. I'll be calling the first 5 speakers. So I'd like to invite forward Del Mar City Councilmember Terry Gasterland, Del Mar City Councilmember Tracy Martinez, Richard Ciaba, Rachel Hayes, Julie Porter, Natalie Raschke, and Yusef Miller. If I've called your name, please come forward. You'll have 2 minutes to address the board, and I'll ask you to please state your name for the audio record.
Thank you. Tracy Martinez, City of Del Mar. I'm happy to be here today on behalf of the City of Del Mar, along with Deputy Mayor Gasterland, to express support for the board's adoption of a resolution in support of the work the city has and will continue to do with the Fairgrounds to bring critically needed affordable housing to Del Mar and the San Diego region. Through a unanimous vote, the Fairgrounds approved an executive negotiating rights agreement, and the city and Fairgrounds will be working together over the next 24 months to determine a mutually agreeable location on the fairground property where housing can be built, and to conduct a site due diligence and other activities necessary to determine the scope of the development and the terms and conditions of a long-term ground lease. Affordable housing is needed in every community, and Del Mar is no exception. The City of Del Mar is committed to being part of the housing solution by bringing much-needed affordable housing to Del Mar, and greatly appreciate the Fairgrounds and the county for your support and partnership. Thank you for your consideration, and I strongly urge you to vote yes on the resolution of support today.
Thank you. Next speaker, please.
Thank you very much. It's a real pleasure to be here. Supervisor Desmond, Supervisor Anderson, and our new supervisor, Montgomery Stepp. And thank you very much, Tara, for sponsoring this item. I am Del Mar Deputy Mayor Terry Gasterland. I'm joined here today by Councilmember Tracy Martinez, representing the City of Del Mar. This project is one that Tracy and I, as housing liaisons for our council, have been working on for years, and it's finally coming to fruition through this ENRA. As part of the certified 6-cycle housing element, the city has committed to facilitating the development of 113 affordable housing units in Del Mar, with a minimum of 61 of these to be targeted at the Fairgrounds. As envisioned, the Fairgrounds affordable housing units would be part of a 100% affordable development, 100% affordable, and yet it will fit into our community so well as we envision it. It will be for low, very low, and extremely low-income households. While we will be working with Fairgrounds to determine whether these units will be for families or seniors, I kind of envision it myself as for families. I think of the kids who are going to be living here. What we do know is that we will be working hard to make this housing happen. The work to be done under the ENRA also fits in very nicely with a master planning effort currently underway with the Fairgrounds. They're going to try to figure out what is our fairgrounds of the future, and in fact, the ENRA process will help them to think through what does it mean to have housing at the fairgrounds. Where on the fairgrounds property can housing be located? This is going to be an important process over the next 2 years. We are excited to continue moving this important work forward and urge the board to adopt this resolution in support of affordable housing at the Del Mar Fairgrounds. Thank you very much for your consideration today.
Thank you. If I've called your name, please come forward. Richard Ciaba, Rachel Hayes, Julie Porter, Natalie Raschke, Yusef Miller. Welcome to come forward in any order.
Hi, Natalie Rashke with Lived Experience Advisors. I came up here thinking we were going to get a pushback from the city of Del Mar. And so, thank you. I'm surprised that they came up here and said what they said. It made me emotional. It also seems that affordable housing comes with a negative annotation anymore. And that's frustrating because every time I come to speak, there's a pushback. Affordable housing shouldn't have any negative for it. My husband and I worked in restaurant many years. Who will do these jobs at these upscale restaurants to these hole-in-the-wall places that nobody really sometimes enjoys doing, cleaning the toilets, prepping this food for, these nice restaurants? Are they making enough to afford the city that they are working in? Do they have to drive from outskirts areas with traffic that costs money for gas, less time with their families? Affordable housing should be put up everywhere. What's affordable anymore? Everything has gone up. Just like the world, we need multi-stuff everywhere, multi-people, affordable housing. Sorry. It's near and dear to my heart. My kids were born and raised here in San Diego. It was doable, it seemed, a while ago. I have a son that's 17. People make these comments about, well, they should just move somewhere else. That takes money too. This is their home. They should be able to not worry about affording or living with their parents. He's 17, 18, he's gonna have to stay at home. Thank you.
Thank you. Next speaker, please.
Hello, supervisors again. My name is Julie Porter. I'm with Lived Experience Advisors. I wanted to say I wholeheartedly support to put to better use some of the underutilized land at the fairgrounds, and I think it's an excellent choice for affordable housing. Thank you for hearing me today.
Next speaker, please.
Hi, Rachel Hayes with Lived Experience Advisors, and I am also shocked that there is no pushback because of Del Mar. I'm amazed at these two women right here fighting for affordable housing that everybody can afford, because we all know we have a housing crisis straight across the board for everybody. It doesn't matter what your income is. And I just want to say thank you to these two women, because it shows a lot. Because I was at Carlsbad, and there's a lot of pushback for their Windsor Point. And it's not fair. If we have the grounds to build the housing, because we need housing. We have a housing crisis, not a homeless crisis. Thank you.
As the next speaker is coming forward, I'd like to invite the speakers in opposition of this item, Mark, Paul the Bold, and Consuelo.
My name is Yusef Miller. I'm with the North County Equity and Justice Coalition, and I am blown away by Del Mar. Thank you for speaking up for affordable housing. And people need affordable housing everywhere throughout the county. No matter where you look, you'll find people who need affordable housing. We're in a housing crisis. This is why we have a homelessness crisis, because we have a housing crisis. So cities like Del Mar and legislators like the ones we see here today are the ones we need to make sure that everyone is taken care of. It was issues like this that caused the Black community of La Jolla to not be there anymore, because the affordable housing was taken away and they were moved off and moved over into Southeast. And this is how we get Southeast and Barrio Logan, from these areas that were only concentrated low-income housing in these areas. But those people of color who lived in La Jolla, who lived in Encinitas, the people who lived in Carlsbad, they were not able to afford those houses, and at the time when they did, they moved them out with these covenants. So to right that action and to fix that action, we need an attitude, progressive and aggressive, to make affordable housing for everyone. Thank you.
Thank you. Next speaker, please.
Mark, this is the main cause of a housing problem. is inflation, intentionally caused by the Federal Reserve. Many presidents talked about this. Abraham Lincoln was probably shot stopping the bankers from forming a national bank at the time. He issued greenbacks. This is a huge problem. Now, affordable housing, of course, since you won't stop the bankers, and of course, it's not within your authority. This is a federal thing. It is, however, your duty and obligation to inform the public that this is the source of the problem that is literally going to bankrupt our country. The poorest people going first, of course. And now, I'm not against affordable housing, except you're not stopping the source of the problem. But the way it's being done, it's a profitable industry. There's BlackRock invests in housing. It's a scam. And it makes so much money for investors, their shareholders making money. Why should something we taxpayers pay for have shareholders when we're paying to try and help the public who's in poverty? When Appy's Core, a 3D printing company, can 3D print structures, 1,200-foot structures for $10,134 each. And that literally means when you guys say, oh, we're doing 60 units or 100 units, well, you could do 50 times that many for the money that you're spending. That is a crime. It's negligent. And if the state has made it so you can't do that through some rule or ordinance, you should call them out on it. It's a scam. So I wish I wasn't out of time.
Next speaker, please.
Richard Siaba, Lived Experience Advisors, and I'm here to show support for your guys' resolution for the affordable housing units. I think it's great that Del Mar is, taking a step towards building more housing and such. I think anywhere you could use the land up and use a space for housing, more housing, especially affordable housing like this. Just go ahead and go for it and go ahead and do it as long as, everybody's happy. I hope. All right, thank you. That's all I have to say.
Thank you. Next speaker, please.
Hi, Paul LeBold. First, I want to make sure you realize I think this is a great idea, putting more affordable housing in. But, here we go. One of you wants to issue a letter of support for what is already being done, finding a place and developing 61 whole units of affordable housing in Del Mar. And I'm glad it's only, by the way, going to be low-income housing, which is what it should be when you say affordable. The City of Del Mar and the Del Mar Agricultural Association, DAA, who owns the Fairgrounds, recently approved an exclusive neighboring negotiating rights agreement, ENRA, agreeing to work together to identify a 1 or 2 acre portion of the site to facilitate the development of at least 61 units of affordable housing. The DA board and the Del Mar City Council unanimously approved the ENRA agreement on February 20th and March 4th, respectively. I think, however, that the county should butt out of issues that are already being worked on. And yes, tiny huts are cheap. You need to spend a lot more for your housing. I don't know why. It's kind of like robbing Paul to pay Peter. And by the way, reading all the documentation, has the county actually been polled, and are you sure the entire county does support this? Thank you.
Final call for Consuelo.
Consuelo. It is refreshing to hear an officials finally echoing what the concerned citizens have been saying for years. Government purposely creates these chaotic situations in order to come in and act as if they are the heroes. But keep in mind, their help will benefit only them. For profit. Pay attention. Stop trusting government so easily. Temporary Band-Aids for what needs to be majorly operated on. Again, please just pay attention to what they do and why it is they do what they do. Don't just get involved when the boot is directly on your face. When you see your brothers and sisters suffering, do something about it as well. That's all I wrote.
Thank you. We'll now hear from the individuals that requested to speak by phone. We'll start with our first caller.
Truth, Terry, it is never a pleasure to be there in person, hence why I'm not. Ugly, sustainable slate gray stack and packs of a fair. What a circus show, all right. Imagine the Sandag-supported multi-billion-dollar tunnel going underneath people's homes in Del Mar and then underneath the fairgrounds. All the noise, traffic, vibration, and land instability from having a tunnel underneath cheaply made yet expensive stack and packs. Would the state buy people new homes if there's a collapse from the tunnel? Doubt it. But why do cities like Del Mar and others keep approving these stack and packs everywhere? One, it gives city government more tax money. And two, it helps city government meet those regional housing needs assessment numbers that the state demands. Numbers that almost every city finds impossible to meet. Those housing quotas even have an annual report due on April Fool's Day. Jokes on every city. And when various city reps were looking forward to address this issue of impossible housing numbers at the last Sandag meeting, the head of the state housing and community development racket, Gustavo Velasquez, couldn't even be bothered to show up. He sent 2 minions via Zoom instead because he's a coward. When are cities going to grow a spine and go against the state's demands? Otherwise, let's just call every city Sacramento and quit pretending we're different. And Tara, you're only supporting this for your political campaign, not fools. This item statement says, quote, the Del Mar Fairgrounds is located within a mobility hub in Sandag's 2021 Regional Transportation Plan, end quote. Do you realize, Sarah, that there's going to be a new 2025 regional plan soon, and that no one's even figured out what even is a mobility hub yet, or where they are, and it's a 40-minute walk to a bus. Just like with the county supporting a Senate bill, the county has no place telling a city what they should or shouldn't do. So unless the county's going to pay for this experiment, it doesn't matter what anyone at the county thinks. Stay out of city business because they're obviously cowardly enough all by themselves.
Thank you. Vice Chair Lawson-Remer, that concludes public comment on this item.
Thank you so much. So this, I brought this forward today to ask my colleagues' support of this initiative underway by the City of Del Mar and the Fairgrounds Board because it really lifts up a lot of the approach we've taken here at the county so far of trying to identify public lands that could be utilized to build affordable housing. We've made that commitment as a county. We've already approved the redevelopment of 11 county-owned parcels to create over 1,500 sites. So we've been moving forward on our land, and I think really excited to see some of our partners in the region doing the same. And I hope that we can really be a partner to this endeavor and be able to help clear away any obstacles that they might find in their path, because we know that that can happen. So with that, I'm happy to answer any questions from my colleagues, but really just hoping to have everyone's support for this resolution in favor of this initiative to build affordable housing on the Fairgrounds site. And with that, I'd like to make a motion. Supervisor Anderson?
I'll second the motion. Madam Chair, it was 3 short years ago, I was complaining because we took my district from 18,500 homes by right to fewer than 600. And you said that you would build them in your district. 137 is now 18,000, but it's a huge step in the right direction. And I never thought you would ever be able to bring low-income housing to beach communities, and yet you've done it. You've done a great job of working hard to make those beach communities more affordable and give us better opportunity to, you know, I used to joke in East County. I'm old enough to remember when Coronado paid off the bridge and they still wanted the tax crossing the bridge, and that was to keep riffraff like me from their beaches. So I'm glad to see that likes of me can now go to Del Mar beaches. So thank you very much for this, and I'm happy to support it.
I just have to laugh at that on the mic. But no, thank you, Vice Chair, for bringing this forward. I do want to thank our colleagues from Del Mar who are here and have been championing this. You know, when I hear the public comment, I think about my grandmother who raised her children in low-income housing, and she wanted better for the generations that came after her, but she had the opportunity to do that because she was in a place that she was able to afford and raise her children. And so it's also very near and dear to my heart, and this is one of those items that, you know, we don't always get to agree on everything, and kind of really feel good and see the work of what we're trying to do. And so as it moves forward, any support you all need, let us know. But I'm happy to support this item.
Thank you. With that, can we please call the vote?
Vice Chair Lawson-Remer, that motion passes unanimously with all supervisors who are present voting aye.
Okay, thank you. Moving on to items 26 and 5, which we'll take together. So Supervisor Desmond, would you like to speak on item 5?
Let's see. Moving faster.
We can do public comment first if you prefer. Okay, great. We'll just begin with public comment, and then we'll be prepared to speak on our items.
Thank you, Vice Chair Lawson-Remer. Again, this is item 5, implementing a pilot program to enhance support to people with serious mental illness at affordable housing developments, and item 26, supporting safety and security at Windsor Point and future projects supported by No Place Like Home funding. There are 13 requests to speak on these two items, 6 in person, 7 requesting to speak by phone. Also note for the record that we received 2 e-comments. One of those was in opposition. Any members of the public that requested to speak on items 5 and 26 by phone, please dial into the conference line using the instructions that were provided to you. We'll begin with the in-person speakers, starting with those in favor of the item. As your name is called, please come forward and stand against the east wall under the murals until it is your turn to speak. You'll have 2 minutes to address the board. I'd like to invite forward Chris Schilling, Yusef Miller, Rachel Hayes, and Richard Siaba. If I've called your name, please come forward. Again, I'll ask you to please state your name for the audio record.
Thank you. Good afternoon, Chair and Supervisor. My name is Chris Schilling, and I work for the City of Carlsbad. I'm here today to express our support for items 5 and 26, and thank Supervisor Lawson-Remer and Supervisor Desmond for advancing proposals to enhance services for residents with serious mental illness in supportive housing developments. When the Windsor Point development opened in Carlsbad, the 24 residents with serious mental illness were provided a total of 1.5 hours of behavioral health services per week. Services were on site on Tuesdays from 9:30 a.m. to 11 a.m. This level of support was not sufficient for all residents, and the city has been working closely with the county and other partners to increase the amount of support available to residents, as well as enhance on-site security. Although we have made good progress, more still needs to be done. These proposals, which include enhanced clinical support and case management, mental health first aid training, comprehensive operational plans, and advocacy for funding of enhanced on-site security, will further help to address the unique needs and challenges faced by this vulnerable population, as well as the broader community. The City of Carlsbad is committed to an ongoing collaboration with the county and other partners to ensure the success of these endeavors. Again, we urge the board to approve these proposals, and we look forward to seeing the positive impact they will have on our community. Thank you.
Thank you. Next speaker, please.
Hello again, Rachel Hayes with Lived Experience Advisors. Every permanent supportive housing that is built or affordable housing that is built has problems. Even where I live, we have our fair share of problems, just like Windsor Point. The difference is we have a great management company and we have great security. 24-hour surveillance, video and audio, doors that always remain locked, community meetings, like I said, every month, so everybody feels safe. I know Windsor Point has had a lot of pushback because of the problems that come with it. We've had our fair share of problems also where other people, residents bring in other homeless people that stay in their units. What they try to do is eliminate that with security and cameras, and if something happens, they can always roll back the footage. I think that at Windsor Point, they should revamp it. If they're that unhappy, get new management that will do the job. I'm through Jamboree, which is based out of Orange County. That is our management company. They have 2 supportive housing projects here in San Diego, one in Santee and mine in San Ysidro, and they are both wonderfully ran. Thank you.
Thank you. Next speaker, please.
Hello, Richard Ciaba, Lived Experience Advisors. I'm here to show support for these items 5 and 26. You know, I live in the same building as Ms. Hayes, my colleague over here, and yeah, like I just kind of want to echo what she was saying. How about you know, you're gonna have problems in apartment buildings such as these. You know, I mean, what apartment building doesn't really have problems, whether it be you know, affordable housing developments or whatnot. I know the people in Carlsbad were not too happy with the Windsor Point apartments, and I mean, you know, we just want to say that we support that. That there's going to be more wraparound services, security, and such like that to help with these places. Because I'm in support for people with, you know, with mental illnesses and stuff like that, to be able to live in a place that's affordable for them, and with case management on site and the management taking care of everything. It should be a fair turnaround and stuff like that. So thank you, appreciate it.
Thank you. As the next speaker is coming forward, I'd like to invite the speakers in opposition, Paul DeBold and Consuelo. Ask you to please line up on the east wall. Thank you.
My name is Yusef Miller in support of this resolution 5 and 26, North County Equity and Justice Coalition. And yes, Windsor Point has its issues, but their issues would be solved with proper wraparound services. Everyone needs wraparound services if they're in this condition where they are not in control of their behavior. So these wraparound services would be a solution to these behaviors. And only 7 of the residents, of the 50 residents, are actually the problem, according to the data. When the calls go out, it's not the 50, it's the 70s, the 7. So we're criminalizing and penalizing other people who need these resources. If we're not careful, we could penalize these others that need this help. We see 44% of the calls go for only 7 apartments. 44%. And then 42% of those are by people who don't even live there. They're visiting, they're guests. So this goes back to the management. Management means tougher security. Management needs to do what they need to do. They need to step it up. Instead of trying to penalize by some of our detractors, and people are trying to say that it's the person with mental health issues that need to be policed and they need to be removed. We need to hold accountable the county, one, for making sure that we have wraparound services, and management for making sure that everyone's safe. We all want safety. We all want security. I want safety and security for the people who are the neighbors, people who live in the neighborhood, and for the people who are there who need services. So all of that needs to be taken into accountability and not penalize our loved ones who need support. Thank you.
Thank you. Next speaker, please.
Hi, Paul Bold. The PHLA and redevelopment programs in general, they need a full discussion, not being combined with other items. We need more affordable housing, but this is not the way. The board letter itself warns us when it says funding will include 189 affordable apartment homes and down payment assistance for 14 households to achieving home ownership. It's a drop in the bucket. Attachment C says that the new units could be the ones already built, but simply rehabbed. The net zero effect. It will subsidize rental housing that is affordable to low to moderate income households, including necessary operating subsidies. The PHLA first-time homebuyer down payment assistance will go to people who earn up to 120% of the AMI, the average median income. This detracts from the goal of providing affordable housing, and these people are above middle income too. And here we go again. You want added security at Windsor Point because of 7 residents, and the neighbors are complaining. By the way, that's what neighbors do. Although the Carlsbad police say that overall crime in the neighborhood has decreased, I do not want my tax money used on a neighborhood spat. And I think that it's interesting that a rich area like Carlsbad can't afford its own security and provides no proof of the need in its report. Thank you.
Thank you.
Tara,
Next speaker, please.
I signed up for, Tara, I signed up for consent, which was 1 through, and item 5 is...
Mark, we heard public comment on item 5 as part of consent. I do not have a speaker slip for you for item 26, and that's the public comment that we're considering right now.
Why I don't get to comment?
I don't have a speaker slip for you for item 26. Comments on item 5 were heard during the consent calendar.
But you pulled...
We made it clear at that time that comments on item 5 were being heard during the consent calendar.
Chairwoman Vargas clarified twice that we were hearing comments on item 5 during consent. So yes, we're on item 26. Thank you.
Consuelo, it's government that sells safety and security, but it's the people that need safety and security from them. Again, I know it may be difficult, very difficult to believe, but behavioral health is also very lucrative, just like the homelessness. I'm going to recycle this. It too will never be remedied by this local government and their crappy ideas. Their interests are not in solving these problems. They are only concerned with the funding they receive due to these problems. If they weren't being funded for these issues, the problems would be solved and fast. You see, it's not beneficial for them to fix anything, hence why they continue keeping the people distracted and dependent on them. Same old thing. What else do I have? Whatever, I'm done.
Thank you. We'll now hear from the individuals that requested to speak by phone. We'll start with our first caller.
Good afternoon, Vice Chair Lawson, Reamer, and board members. I'm Jimmy Silverwood, president of Affirmed Housing, the developer of Windsor Point and Carlsbad, speaking in support of items number 5 and 26 before you right now. Our company consistently ranks among the top 10 affordable housing developers in the state of California, and we have successfully developed affordable housing projects in each of your districts. These communities are renowned for their beauty, awards, and providing safe environments for our residents. Over the past 8 years, we have also dedicated ourselves to providing housing for our most vulnerable citizens, our unhoused neighbors, years, with 1,000 supportive housing homes now operational throughout the state. Today, I wish to address Windsor Point and Carlsbad. What distinguishes Windsor Point from most permanent supportive housing projects is its inclusion of homes designated for our No Place Like Home tenants who have diagnosed serious mental illnesses. Residents are referred through coordinated entry in the county, and neither a firm nor a property management company select placements. On-site supportive services are what make these supportive housing developments successful, and we're confident that with additional on-site support, along with our current on-site provider, Interfaith Community Services, that the project will be an even greater success. We look forward to working closely with county staff in hopes of implementing the recommendations if approved. Lastly, we'd like to extend our sincere gratitude to both Supervisor Desmond and Supervisor Lawson-Remer and their staff for bringing forth these recommendations here today, recognizing that we at Affirmed, we're housing providers, and we need the support of our local government to continue to house some of the most vulnerable folks of our society on their road to stabilizing their lives and getting back on their feet. Thank you very much for the opportunity to speak.
Thank you. Now hear from the next caller.
Hey, it's true. Close your eyes and tap your hands together 3 times and think to yourself, there's no place like home. Wake up, honey.
There's no place like home when government interferes in the housing market. And it was not hard for me to believe that it's lucrative because all I had to do was listen to the scripted callers and speakers. A question, why are there safety concerns at this so-called affordable housing project in Carlsbad? Is it related to the supportive wraparound services maybe enabling substance abuse? Why is it that county projects cause negative effects upon cities like Escondido and Carlsbad? You shouldn't need lessons to be learned. There should have been proper planning. The neighbors who bought their homes long ago didn't sign up to live near county-created drama. These projects actually take up homes, raising the prices of homes on the market, and disenfranchising hardworking people from being able to move in. These government projects cost the city of Carlsbad $8.3 million and the county $13 million, with an unknown amount contracted with the Alpha Project for case management of people living there. More than $23 million of taxpayer money doesn't sound so affordable. Sounds like the taxpayers built mansions for people who've never even had a house before. Too bad that's not actually what these box units are. These projects are so unsafe they require 24-hour security. The question, how does the county stabilize an addict? How does the county adjust a person who's been homeless for 30 years? How successful have these experiments actually been, and for how many people? There's an item today about data. Well, where is it? Are these millions being spent wisely, or would we be better with a different housing first by giving us our taxes back first so we have a house and don't need you red tapers and government? Here's the positive. I like the little free library on Harding Street near all the shopping carts on the sidewalk. Great project, guys.
Thank you. And Vice Chair Lawson-Remer, that concludes public comment on this item.
Thank you so much, and I want to thank Supervisor Desmond for bringing forward item number 5. I think together these actions will be able to ensure that our No Place Like Home funded permanent supportive housing projects are safe, secure, and successful in improving the lives of residents and are also good neighbors. We all agree that housing is a vital tool to help formerly homeless individuals get off their streets and onto their recovery journey, but we all know that this is not a one-size-fits-all solution, and that issues do arise, and I'm very committed to working through these issues and making sure the county can be nimble and responsive in working with local partners to make adjustments. So this item 26 that I've introduced today, builds on several months of collaboration with the City of Carlsbad, the Carlsbad Police Department, the development team, and many local residents and community members. I've heard a lot of concerns about a number of issues, and public safety continues to be a top priority. So we're looking at how we can bring more security. I met with the developer last week and pleased to report that additional security has already been added to the property. So that is an important step forward. And this item calls on the county to ensure that we can provide enough flexibility in utilizing our No Place Like Home funding to support this increased security team. Secondly, we're looking at additional services as well. Since January, in response to community concerns, our county increased on-site case management services to 5 days a week and added a clinician to the support team. I appreciate Supervisor Desmond is also looking for ways to further increase clinician support for No Place Like Home funded properties, and I'm fully in support of that idea. Also important to uplift the visitor sign-in policy. In speaking with the developer, I understand they have added a new visitor sign-in policy, and they're going to be providing updates on this in the near future. And I finally just want to thank the County BHS and HCDS staff for their continued work on this item. So with that, I'd like to make a motion for both items 26 and items 5, and turn it over to my colleagues for any comments.
Well, thank you, Chair. I appreciate it. And yeah, I do think 5 and 26 pretty much complement each other in trying to get the things accomplished throughout the county, not just at Windsor Point, because what I put forward is actually a pilot program to enhance people with severe mental illness at affordable housing projects. And that pilot program would include Windsor Point, but also 3 other sites in District 5, the Valley Senior Village in Escondido, the Greenbrier Village in Oceanside, and the Santa Fe Senior Village in Vista. So what we learned in Carlsbad and with Windsor Point, we've got to get people into the right level of care that they need. You know, we had severely mentally ill people being placed in a facility that did not have 24/7 on care available. It was from 6 a.m. to 6 p.m. 5 days a week. And people that are severely mentally ill are severely mentally ill 24/7. So we have to make sure we have people on site that are trained. So whenever we place individuals with serious mental illness in communities, we must provide them with a higher level of care and a 24/7 on-site trained personnel. This action would increase the level of services to include, as Supervisor Lawson-Remer mentioned, a clinician 7 days a week to be available. Also provide mental health training to all personnel on site so that they know how to de-escalate a mental health crisis, and how to connect directly with the clinician, and 24/7 behavioral health services countywide. The training hopefully is going to reduce calls to 911 by the local residents so that the local police departments aren't burdened with responding to mental health crisis calls. The board letter also directs county staff to work with developers, property management, and service providers to come up with a plan to ensure there is trained personnel on site 24/7. And this could be the property management, other service providers, even the hired security guards. If they're trained in de-escalating mental health crises, I think that would be a big step in the right directions. But what matters is that someone is there 24/7 who is monitoring and trained in responding to mental health issues. Plan would also include a way to ensure guests are checked in and out of the building. Right now, anybody can have friends over. You can have, we've had some instances of drug use and child abuse, rapes and other things happening during the off hours. And we make a commitment to people. You know, when I heard the term wraparound services, I figured that was a full wraparound, but apparently from 6 to 6, Monday through Friday, is not wraparound. And so we need to provide those services continually. So what really kind of brought this up for me was, and not to impede on District 3, but with Carlsbad, but I meet with the mayors once a month around the 78 corridor. And the mayor of Carlsbad brought up and said, hey, we are never going to do this again. And to put this type of housing in. And the other mayors along the 78 corridor heard the same thing and said, well, wait a minute, we got to make this stuff, we got to make this type of housing work. We have to be able to make it work, and we got to be able to tighten it up. So it's a learning experience. This is new to all of us. And as we put more people in, I think we'll learn from the experiences and make it better, and particularly making it safer for everybody, not just the people that are residing in the houses, but also the neighborhood. So I really think, we've got to do good by people. We also have to be good neighbors as well. So I appreciate, I'll second the motion. So I appreciate item 26 along with item 5.
Great, thank you so much. So there's a motion by myself, seconded by Supervisor Desmond, for approval of items number 5 and 26. Please vote.
Vice Chair Lawson-Remer, that motion passes unanimously with all supervisors who are present voting aye.
Okay, thank you so much. We're moving on to item number 22, which is the report back on the Rural Health Post-Hospital Discharge Pilot Program. Do we have a staff presentation on this item? Great.
Good afternoon, members of the board. In March of 2023, the Board of Supervisors authorized a rural health post-hospital discharge program in the Mountain Empire community and directed staff to return to the board within a year to provide an update. Mountain Empire is one of the most economically challenged areas in the region, and the Rural Health Post-Hospital Discharge Program was established to help address health care needs while also reducing the impact on the 911 system. We're before your board today with a presentation on the results of the pilot program and to seek direction on the future of this initiative. I'm joined today by Jeff Collins, Director of County Fire, and Chief Nursing Officer Angela Mitchell. I'll first turn the presentation over to Jeff.
Thank you, Holly. In 2021, the Grossmont Healthcare District established the Rural Health Coalition to address health inequalities in Mountain Empire. The group included community leaders, healthcare providers, County Fire, and the Health and Human Services Agency. Mountain Empire has the highest percent in our region of the population living below the federal poverty line and has a higher prevalence of isolated seniors and residents living with disabilities and health challenges. There is only one clinic, San Ysidro Health, in Campo to serve the entire population. Residents needing services in urban communities drive well over an hour each way, creating a significant access barrier. County Fire paramedics are often called upon to address urgent and non-urgent medical needs through the 911 system. The main goal of the program is to keep people in their homes after being discharged from the hospital, which lowers the burden on 911 service and the emergency department. The pilot program began last June. For the 3 years prior to the start of the program, the 30-day unplanned hospital readmission rate averaged 12.1%. In urban areas where SHARP has operated a post-discharge program, readmission rates have stabilized and have been trending down over the last several years. Mountain Empire didn't have a post-hospital discharge program due to distance barriers and a much smaller population size. For the pilot program, any patient discharged from SHARP Grossmont and living in Mountain Empire is eligible to receive this free service. To share more on the program, I'll turn the presentation over to Chief Nursing Officer Angela Mitchell.
Thank you. Thank you. The Rural Health Post-Hospital Discharge Team consists of a county public health nurse and County Fire, CAL FIRE paramedic captain. The team makes home visits to engage patients where they live to support their well-being. The county public health nurse reinforces the hospital discharge instructions, verifies a follow-up appointment with a primary care provider, performs clinical and social assessments, provides case management services, and makes referrals to the county's self-sufficiencies programs such as Medi-Cal, CalFresh, and our Aging and Independent Service programs. The paramedic evaluates the residents for defensible space clearing to reduce wildfire risk, evaluates for safety hazards inside of the home, such as trip hazards, ensuring that there's smoke detectors in place. And if the patient was critically ill, the paramedic would initiate the 911 response for an ambulance transport to the hospital. Early in the pilot, we realized the population participating had unique needs. The team engaged clients who didn't have food in their cupboards or refrigerators or who had bathrooms that weren't working. The team purchased groceries until social services programs could fill the gap, and our paramedics fixed broken toilets to ensure patients had sanitary conditions in their homes. The program has operated for the past 7 months and has been well received by participants. This video was created by County Communications Office, shows some of the great work our nurse and paramedic team are providing to our residents.
To better provide service in the rural East County. What we do is we pair a fire captain paramedic with a nurse, and we visit patients who are discharged from Grossmont Hospital that live in certain zip codes to help monitor them and make sure that they're compliant with their visits, their medications, and to prevent readmission to the hospital.
Well, I've been in the hospital this year more than I've been at home. I've had a lot of health issues. This year has been the worst.
It's not just a medical, it's more of a holistic care that we provide. It's also looking at the social services, seeing are they set up with food, are they set up with transportation, and also we're just someone that they can talk to.
Well, it's real convenient. I don't have to go anywhere.
We visit them once a week, and the visits can vary from in-person visits, it can be telephone visits, but we really try to focus on the in-person visits.
I'm hoping that we're going to save some money on gas. I mean, who can afford gas? Nobody.
The nurse goes over a whole battery of questions with them to make sure that they're getting the things that they need. And then the fire captain paramedic will be doing some other kind of home safety surveys and things like that that doesn't interfere with the nurse's evaluation of the patient.
I think not just for these patients here in the rural areas, but for everyone, there's a lot that we don't know about navigating our medical care and our social services. So as a rural health nurse in this program, we are that linkage and we provide that education so people know what's actually out there and how they can utilize them.
The benefit to the patient is they're getting services that they wouldn't normally get. We're making sure that they're compliant on their medications, that they're following up with their primary care physicians. By visiting these patients, we're decreasing the need for them to call 911. We are keeping those 911 services available for other emergency patients because these patients are getting attention by a different mechanism. It actually makes their quality of life much better.
Well, now I feel okay. You know, I'm probably only 75%, but I feel better.
During the pilot program, more than 60 patients completed, are active, or are in the process of enrolling in the pilot program to receive follow-up care from our nurse and paramedic team. The results shows that those who have elected to participate in the program are nearly 3.5 times more successful in avoiding readmissions as compared to those who were not enrolled. And those in the program who were readmitted to the hospital remained out of the hospital nearly 10 days longer than those not receiving weekly visits from our team. Additionally, the team has provided over 350 nursing, social, and home resources that have contributed to the overall well-being of these patients. I will now turn the presentation back over to Jeff.
Thank you. The program has shown that in addition to positive health outcomes for patients, it benefits the healthcare system. With Medicare specifically, hospitals see a decrease in revenue if patients are readmitted within 30 days for the same medical condition. Sharp Healthcare projects that the total cost avoidance over 12 months may exceed $350,000. This is in an initial assessment and is only cost avoidance. Each unplanned visit that is avoided promotes bed availability within the hospital and skilled nursing facilities and reduces the long wait times at hospitals for ambulance transportation providers. If the board authorizes the program to continue next fiscal year, County Fire will work with Sharp Healthcare and the Grossmont Healthcare District to identify external funds to support the patient care team. The Grossmont Healthcare District Board recently approved $125,000 to support continuation of the program. In addition, with HHSA, we are engaging the Medi-Cal managed care plans to determine if services provided can be reimbursed. I will now turn the presentation back over to Holly.
Today, we're asking the board, after receiving this presentation, to provide direction on the future of the program. Recommendation 2A would conclude the program after the pilot period. Recommendation 2B directs county staff to work with Sharp Healthcare, the Grossmont Healthcare District, health insurance plans, and other entities to identify non-county funding to fully support the program. We would return to the board if additional action is needed. If the board selects 2B, then recommendation 3 would approve and authorize the clerk of the Board of Supervisors to execute upon receipt revenue agreements, including any annual extensions, amendments, or revisions that do not materially impact or alter the services or exceed $500,000 annually from Sharp Healthcare, Grossmont Healthcare District, or insurance agencies for the period of July 1, 2024 to June 30th, 2029. And this concludes our presentation, subject to your questions.
Great, thanks. I'm going to turn it to my colleagues for comments before we go to public comment. Supervisor Anderson.
Thank you, Madam Chair. I think Rose Turner, the Director of Integrated Care Management for Sharp Grossmont Hospital, is here. And, oh, there she is. Now, I'd love to hear from her to get their side of what's going on. And I just, every one of my constituents that called our office loved this program and felt better about it, just like the gentleman in the video. But Rose, if it's all right with the chairwoman, may we hear from Rose?
Can we call Rose up? That would be great. Thank you.
Thank you. Thank you, Supervisor Anderson and the board, for letting me speak. I am Rose Turner. I am the Director of Case Management and Social Work Services at Sharp Grossmont Hospital. The referral for this program starts with my staff, who are RN case managers and social workers, who in their assessment recognize patients that live in the East County. At the moment, it covers 9 zip codes. And the program is voluntary, but we do our best to advise patients to sign on. And there are many times when the county staff can come in and talk to the patients individually. East County is a very vast area. Because it is so large and patients live so far apart, it is incredibly difficult for my staff to get agencies to go out to that area and provide home health, DME, hospice services. It's almost non-existent. So this program provides the patient education and the oversight from a nurse and a medic to help these patients understand their health care issues and live healthier lives. We get rave reviews from all the patients about it, the ones that end up getting readmitted. And I would say the county staff that goes out are absolutely phenomenal. They've taken a non-existent program and really developed it from day one to meet the patients where they are, to meet the patients in their home environment, no matter what it is, and at their health literacy level. This program allows us to meet the health inequities that you find out there in the community. One other thing I'd like to tell you is that every patient wants to be seen and every patient wants to be heard. And this program hears them and sees them out in the community. Thank you. Any specific questions?
I don't have any questions for you, but thank you for sharing your perspective. With that, I'd just like to say what an outstanding job, and I want to make sure I get this right. I want to give a heartfelt thanks to the county fire, the medical care service teams, the Sharp Healthcare and Grossmont Healthcare District, and all the members of the Rural Health Coalition for your dedication, adaptability, and teamwork. When I proposed this, I thought we had a chance at getting something really done, and my office has received so many calls of appreciation for the great work that you've done, and the stats and the numbers show that it's working. We're giving better health care at a lower rate, and that's the direction we need to go. So with that, I'd like to make a motion.
Okay, thank you. Supervisor Jim Desmond?
I'll second the motion, and I'd like to thank staff for the update. Did a great job of the program. It's encouraging to hear the outcomes and the benefits. Thank you, Supervisor Anderson, for bringing this forward. I'd like to see this to grow into other rural areas, particularly North County Inland. I would love to see that program up there as well. So thank you very much.
Thank you, and I just want to also thank staff for all your work on this. I really appreciate the data that just shows us that it's working, and I think that's the whole point of a pilot. You think, hey, maybe this is a good idea, maybe not. Let's try it, and we tried it, and it turns out it's a good idea. So that's exactly the point of having a pilot, and exactly the reason we collect data. And I just appreciate the proposal to bring it forward in the first place, and the work to make it a reality. So with that, please call for...
Well, I was so eager to make the motion, I neglected to say 2B.
Oh, 2B. Thank you, sir. 2B. Supervisor Anderson. Okay, second for that. Great. Could you please call up a public comment?
Thank you, Vice Chair Lawson-Remer. We have 8 requests to speak on this item, 4 in person and 4 requesting to speak by phone. Also note for the record that we received 1 e-comment in favor. Any members of the public that requested to speak on item 22 by phone, please dial into the conference line using the instructions that were provided to you. I'd like to invite forward the following individuals, starting with the individual in favor, Paul the Bold, followed by the individuals in opposition, Mark and Consuelo. You'll have 2 minutes to address the board, and I'll ask you to please state your name for the audio record.
Hi, I'm Paul Bold. The project works spectacularly. In terms of numbers, that in the first 6 months of the program, the unplanned 30-day readmission rate dropped to 4% for patients receiving those services compared to 13.9% for those who did not participate in the pilot, and resulted in an estimated cost avoidance of $350,000 to the Sharp healthcare system in the first 6 months. The unplanned readmission, 30-day readmission rate dropped to 4% for patients receiving those services. And so it's all great. Thank you, Joe. Great idea. I also note that by promoting healthier people, this program cuts down on the beds that BHS requested, supplies and staff hours needed in the previous items, also reducing the county's costs for step-down beds. The only note of caution I have is that I hope that this program does not replace indigenous medical practice with Western medicines, such as the jab or psychotropic stuff, unless it's absolutely necessary. Again, the program sounds great, and I hope it is continued and at a larger scale. Thank you.
Thank you. Next speaker, please. Final call for Mark and Consuelo.
Mark, I'm not actually opposed to this program. It sounds like a good idea. However, it wouldn't be necessary if government was doing its job. We eat a lot of foods that were GMO foods, and the poor people in the east rural areas can't really afford organic food. In fact, a lot of people I know can't afford organic food. And there's glyphosates, there's toxic poisons. The water has fluoride in it. It's actually a byproduct of fluorosilicic acid, as I recall. It's a byproduct of fertilizer. All this is in our system, and incidentally, the water for this isn't quite that far east, I don't think. They probably get their water somewhere else. But the water for La Mesa and Grossmont, there's the mine that was put in. I'm not good with years when I don't have something to gauge it by, but I think the sand mine east of Lakeside, maybe 4 or 5 years ago, that was put in. A lot of people didn't like that. It's literally polluting one of our third largest water aquifer, which just goes to show you how much the government cares about us having water. It's quite the opposite. They want to limit our water because that's a way to control us. And they don't want prosperity, they want austerity. And that's what global warming is really all about. Because in case you haven't noticed, nobody's really actually walking out their door concerned that PB is going to be flooded. And by the way, I was born and raised here, and I can't tell the difference in the water than when I was 5 years old, standing down there in PB looking at the water. I'm sure it fluctuates. Anyway, so it's too bad. So many things that could be better.
Thank you. Next speaker, please.
Consuelo. So I'm positive that there are caring individuals who work for this program. Unfortunately, they're not being supported due to the history of failures of these programs from the past. It's only a matter of time. Getting government to get to the actual source of these mental and physical problems is another pipe dream. They won't solve anything because it's them who's the problem in the first place. We have allowed this, we have allowed it all. Government has no business being involved with the people's health. Why? Because they don't care. They're only interested in the people's health due to them being long-term patients. Again, it's lucrative. A better quality of life? Who deems it better? It's awful. People are so blind to what government does. Nothing they offer benefits the people for the better. Healthcare in general in America is a joke. It's sad. Again, reminder, government is not in the business of fixing anything, including our health. Money and control is all it's about. Snap out of it, wake up.
Thank you. We'll now hear from the individuals that requested to speak by phone. We'll start with our first caller.
It's truth. A pilot program is another way to say people in government are experimenting upon their neighbors with taxpayer money. What is this item about? Quote, in the first 6 months of the pilot program, the 30-day readmission rate has dropped to 4%. Cost avoidance of $350,000. With Medicare, there are penalties if patients are readmitted within 30 days, end quote. It's about doing what the state demands and saving money. According to the county staff, the only readmission difference between those enrolled in the program and those not enrolled was a measly 9 days. That's not a sign of good health that people need to return to the hospital at all. It cost the county $474,000 to create this program, but isn't it Sharp Hospital's job to ensure a post-hospital discharge program for the rural areas like they do for urban areas, not the county's job? This is basically saying that Sharp is so bad that two government bureaucracies, the Health District and the Rural Health Coalition, had to be created. And is only one paramedic and one nurse enough for this program? It's items as the nurse alone is responsible for at least 6 different jobs. And I can't see county staff or CAL FIRE having time to buy people groceries, hardware supplies, and medical devices like this item says. And I find that a ridiculous stretch of the job. I'm also curious what you supervisor's solution is for all the hospitals being filled with new patients in numbers we've never seen before. Is it the clot shot? Or is it because of all the newcomer, faux asylum seeker, illegal immigrants, as I've heard many people allege? Why are doctors prioritizing people from other countries and not our veterans? See, nurses can help people make follow-up appointments with a primary care provider. But if that primary care doctor is never available, then the program's useless. I've also heard about a record number of people getting taxpayer-funded ambulance trips to hospitals where after arrival they walk away because they never really needed help. Overall, NOTA, $460,000 more to expand this, plus $300,000 a year just to save a private hospital money. Business. No thanks.
Thank you. Vice Chair Lawson-Remer, that concludes public comment on this item.
Thank you so much, Supervisor Montgomery Stepp.
Thank you so much, Chair. I just have a couple of comments. I want to thank staff for this update. I wasn't here for the original passing of the pilot program, but it's good to see that it is successful. The outcomes from the program to date are very promising, and as we have seen, and demonstrate both improved health outcomes for patients and cost savings for medical systems. And I also appreciate the focus on the upstream solutions as reflected by the home safety inspections performed by the paramedic. This all around is a good program, and I just want to voice my public support for it, and I will be supporting this item. Thank you.
Thank you so much. We have a motion by Supervisor Anderson, a second by Supervisor Desmond. Can we call the vote?
Thank you, Vice Chair Lawson-Remer. That motion passes unanimously with all supervisors who are present voting aye.
Thank you so much. Okay, we're moving on to item number 23. And I think we have a staff presentation. Fantastic.
This is item 23, Office of Evaluation, Performance, and Analytics, update to the Board of Supervisors and approval to waive Board Policy A87 and award contracts for research and technical assistance to universities.
Vice Chair, members of the board, I've had the great pleasure of seeing the development of the Office of Evaluation, Performance, and Analytics come together from the beginning, and proud to be able to take this opportunity to lay the groundwork of the department and work that Dr. Ricardo Basurto Davila, Chief Evaluation Officer, and Dr. Hannah Feldman, Chief Data Officer, will expound on today and as requested at the January 23rd board meeting. A lot of thought and effort has gone in creating an office that will honor the long history of using data to improve our services and inform decision making. Some of our departments and business groups have built a considerable capacity in this area. When your board approved the establishment of the Office of Evaluation, Performance, and Analytics, known as OEPA, this act was not only in direct alignment with the county's culture of providing quality public service while maximizing our resources, but it moved to elevate and enhance it across the enterprise, all departments, all divisions, and all units. This is why the existence of OEPA is so important, and the work they are doing is so valuable for the county, to be further empowered with information when moving towards a decision, whether it is a policy decision or it is an operational decision. What resonates with me is the powerful concept this instills in every one of our 20,500 employees to make the most informed decision in order to provide the best high-functioning programs we can offer. With that, Ricardo, the floor is yours.
Thank you. Good afternoon, Vice Chair Lawson-Remer and members of the board. I'm Ricardo Basurto Davila, the county's Chief Evaluation Officer at the Office of Evaluation, Performance, and Analytics, or OEPA, and I'm joined today by Dr. Hannah Feldman, the county's Chief Data Officer, also at OEPA. Governments across the country are facing rapidly evolving challenges, such as the COVID-19 pandemic, a housing affordability crisis, and a bleak fiscal outlook, among many others. In this context, it is critical for county leaders to be capable of making quick and effective decisions. Our constituents expect a government able to solve problems, and they're not always willing to take our word for it. They want to see evidence. In 2021, your board took a decisive step towards making the county a leader in evidence-based decision-making, establishing OEPA and giving us an enterprise-wide mandate to provide leadership, coordination, and capacity building around evidence-based policy-making, program evaluation, data sharing, and metrics. In other words, it is our responsibility to ensure that county leaders can easily leverage evidence to inform their decisions. It should be routine for you to have access to high quality and useful information so you can incorporate it in your decision-making process. We should acknowledge that the county has made significant progress in this area, much of it before OEPA existed. We are and will remain supportive of existing efforts that are consistent with OEPA's vision, which is fostering evidence-based practices and results that matter in support of a county that is effective, efficient, and trusted by the public. OEPA is composed of 3 branches, each tasked with leading and supporting different aspects of translating data into actionable results. The evaluation branch leads studies to answer critical questions about what works and what can be improved in services provided by the county. An example is the evaluation of the shallow rent subsidy program, which will help us determine to what extent rent subsidies help prevent homelessness among low-income seniors. The performance branch supports the development of indicators of progress towards achieving strategic and operational goals. As an example, last month we presented to you our work on performance metrics for alternatives to incarceration. These metrics will help stakeholders understand how many people receive ATI services, what services they receive, and whether they successfully complete programs. Finally, the Data and Analytics branch manages OEPA's data and leads advanced analytics projects. An example of their work is the development of predictive models to identify populations at high risk of experiencing adverse circumstances. These analyses will help the county's ability to use preventive rather than reactive approaches to address these problems. Over the past 2 years, we built a remarkable team that combines a deep understanding of the county and our programs with solid technical and subject matter expertise. Our staff is knowledgeable in policy areas of high priority to the county, such as affordable housing and homelessness, aging, behavioral health, diversity, equity and inclusion, social programs, sustainability and environmental justice, public safety, and many others. As proud as we are about the team we built, we also acknowledge that much work remains to be done. Many governments around the country are trying to increase the use of data to inform their decisions, but few have achieved the systemic change required to reach the full potential of an evidence-based government. This slide shows OEPA's evidence framework, which is our strategic approach to help the county become a learning organization. That is, one that asks tough questions, is open to making adjustments, and is willing to innovate to find better ways to achieve results. The framework consists of 3 core strategies. First, developing and implementing a structured approach to prioritize the use of data to make decisions. Second, getting the most value out of the data we have. And third, increasing the county's capacity to use data to make decisions. We will describe each of these strategies in the next few slides. Governments often lack a coordinated and integrated approach to prioritize the use of data for decision-making. In practice, this can lead to studies of low-priority issues or that answer questions of little relevance to policymakers. It is critical for us not to make this mistake. We are not academics, and thus our work should have practical value and produce actionable results. In July of last year, we submitted to your board the annual strategic research plan, which is a critical piece of our approach to prioritize how the county uses data for decision-making. The plan seeks to ensure that the county's research and evaluation work is aligned to the county's strategic priorities: sustainability, equity, empower, community, and justice. The plan's learning agenda identifies key questions aligned to these strategic priorities. These questions, meant to guide not only OEPA's, but the county's research and evaluation work, involve topics like prevention and reduction of homelessness, justice system reform, improving the recovery of unpaid wage theft, and evaluating the county's climate action measures, among many others. To provide transparency and highlight the value of our work, the strategic research plan also describes our current projects. One example is the evaluation of the Family Income for Empowerment program, which provides monthly cash payments for 2 years to families at high risk of involvement in the foster care system. To evaluate this program, we cannot simply check if children in families who receive the cash later become in foster care. Even if none of them did, that doesn't tell us what would have happened without the program. Instead, OEPA will compare child welfare outcomes for families randomly selected to get the payments to those not selected to get them. Because we also want to know what happens after the payments end, it will take 3 years for us to have final findings, but we will report preliminary findings along the way. Results from this evaluation could inform the transformation of the foster care system, not only in the county, but even at the state or national levels. If cash payments help address the root causes of child neglect that are related to economic hardship, we could improve child and family well-being through preventive rather than reactive measures. This will be not only less disruptive for families, but also consistent with the mission of our new Department of Child and Family Well-being. The second element in this strategy is the development of an inventory of all county programs. Our goal is that you, other stakeholders, and the general public will no longer need to reach out to the Chief Administrative Officer, Deputy CAOs, or county departments to ask for a list of everything the county is doing in a particular policy area like homelessness, behavioral health, or the environment, as this list will be easily accessible. Moreover, OEPA will research the studies related to each program in the inventory. So not only will we have a list of all programs, but we will also know how certain we are that they are having the desired impact. This will give county leaders more confidence in the resource allocation decisions and will help OEPA and county departments prioritize evaluations of programs for which we are less confident about their effectiveness. I should note that it took 7 years for a Midwestern state and 13 years for the federal government to build their program inventories. We began working on ours last year and plan to build the initial list of programs before the end of this calendar year. The final piece of this strategy is the strategic performance framework, which will establish metrics for the county's strategic plan. OEPA is working with all business groups to establish a single location where anyone will be able to check the county's progress in achieving the goals of the strategic plan, so we have access to timely information that will help us determine in which areas we're doing well and which ones require additional efforts. Altogether, these three initiatives will help OEPA and county departments assess our gaps in knowledge and thus ensure that we are prioritizing high-value projects that will produce results that matter. I will now turn over the presentation to Dr. Feldman.
Thank you. We recognize that our residents often require multiple services from the county, creating a complex web of interactions. To better understand service outcomes, in collaboration with the County Technology Office, we've developed the Enterprise Integrated Data Platform. Prior to this platform, it would have taken years to develop a typical database solution. Using this technology, we have been able to build this in 10 months. This cloud-based system utilizes artificial intelligence and the latest analytical tools. It consolidates data from various department sources, modernizing how we link clients across services, conduct secure data analyses, including predictive modeling, and generate informative dashboards. Additionally, it has the capacity to integrate data from external sources, potentially enhancing our ability to support clients. While we're excited about the possibilities this platform presents, we also recognize the importance of robust data governance. Therefore, we have established a data governance system that protects individuals by ensuring compliance with privacy regulations and maintains data quality. Because this was in place, we have been able to move forward with data sharing efforts like the Alternative to Incarceration's Measurement and Evaluation Framework. The data platform will be the technology tool to operationalize the framework's performance measures. We are looking forward to embark on this journey with our county department colleagues to enhance county services through data-informed decision-making and improved data governance practices. I will now return the presentation to Dr. Basurto Davila.
Thank you. OEPA cannot and should not lead all efforts to use data to provide useful information to county decision makers. Instead, we should foster a culture of continuous learning and improvement and help county departments increase their ability to take on some of this work, either by themselves or in collaboration with other partners. This is the third strategy in our evidence framework. To do this, we first need to understand where our departments currently stand. For example, the county has long used performance measurement for continuous improvement, and there is already significant expertise in this area. We acknowledge this and want to make sure that we focus only on areas of real need. In December, we sent a survey to all county departments to gather information on their current capacity and needs around program evaluation, performance measurement, and other types of data analysis. We are in the final stages of this project and will soon summarize the results in a report that will guide our efforts to build additional capacity. The emphasis on having in-house capacity for program evaluation makes the County of San Diego unique. Most governments rely on contractors to lead their evaluation studies, but that comes at a cost. Evaluations are expensive. We would be paying several millions of dollars just for OEPA's current evaluation projects. And it can be difficult for government employees to judge whether the right methodology and data are being used to answer the questions of interest. Last year, we trained 30 employees in the county's land use and environment group on core concepts and the elements of a good evaluation study. Whether they work with OEPA or an external evaluator, these staff are now better prepared to demand and support high-quality evaluations that successfully answer the questions of interest to the county. By the end of this month, almost 100 employees of the Health and Human Services Agency will have completed this training, and nearly 40 from the Public Safety Group have already enrolled to take it next month. After that, we will proceed to train staff from the Finance and General Government Group. Moving forward, we will continue to identify areas of need for other training or internal capacity building efforts. The final element of this strategy is engaging external partners that can help make our work better. In our current projects, we are already benefiting from collaborations with national leaders such as the Massachusetts Institute of Technology, the federal government's Office of Evaluation Sciences, and Casey Family Programs, a research organization renowned for their work on child welfare. These collaborations have been extremely valuable to our projects, as these organizations not only brought their technical expertise, but have also been willing to adjust to the county's priorities. OEPA is not alone in benefiting from these types of partnerships, as several county departments have also developed long-lasting relationships with external researchers. We seek to continue fostering these collaborations and to establish new ones. So far, we have described the structured framework to use data for decision-making. We would be naive if we expected all of our work to be predictable and to fit neatly within this framework. We understand that priorities can evolve quickly and that emergencies can occur at any moment. We are ready to adapt and respond when necessary, and we have already proven we can do so. This slide shows several recent examples when OEPA was asked to support efforts outside our major initiatives, such as conducting data analysis for the response to the January floodings, providing advice on performance metrics to the Community Corrections Partnership, and analyzing data for a survey on the housing blueprint, among others. We will continue to be a resource for other county departments whenever our support is needed. This slide shows a timeline of milestones for projects we completed recently and expected completion dates for our current projects and major initiatives. As you can see, over the next few years, we expect to bring you findings for many important projects that could inform future decisions. Among others, these include the evaluation of pilots like the Shallow Rent Subsidy Program, Family Income for Empowerment Program, Recovery Action Fund for Tomorrow Program, and performance metrics and evaluations for the Alternatives to Incarceration Work Plan and Shared Housing for Other Adults Program. In addition, considerably more work is coming our way, as we are getting ready to start working on several additional projects, and we are also in active conversations with departments across all county business groups around many other potential projects. As these conversations turn into more concrete plans, we will update our website to continue being transparent about the work we're doing. Finally, I would like to highlight today's recommendation, which would allow OEPA to expand our capacity building efforts through contracts with universities to receive research and technical assistance from them. Our goal is to establish partnerships with institutions that have a robust understanding of the county and the issues that are important to us. Vice Chair Lawson-Remer, this concludes our presentation, subject to any questions from your board.
Thank you so much. So first I'm going to turn to my colleagues for any comments and questions to our presenters, and then we'll go to public comment. I just want to thank you guys for the progress. I know this has been a big lift, and you've been working really hard, and I see a lot of progress. I also was just really excited. I know you mentioned that there was, I think, 40 LUSH staffers and about 100 HHSA staffers who've signed up or completed trainings to build out capacity on data utilization across the county. So I thought that was great, not just having a few folks in OEPA drive forward this work, but really deepening this kind of commitment across everybody, all hands on deck here at the county. Program inventory, it sounds like a very important first step, right? We should know what we're doing, and public deserves transparency and being able to get access to that information. So that seems like a great first step. And I appreciated the evaluation examples as well. I'm pretty excited for that foster youth program and the shallow rinse subsidy, and just sort of getting back some of these results. If we do a pilot, let's see if it works. And if it works, let's do more of it. If it doesn't, then we know that was not something we're going to continue. So I think it's, in my view, exactly the reason to be doing these evaluations. So just appreciate your presentation and how much work you've done. I did have one question. I'm wondering if you feel like you've encountered any big obstacles, and if so, what are those?
I can't think of any major ones. I mean, we've been very lucky to have great partners within the county, and also to have access to external partners. If anything, it's just, there's a lot of work to be done. There are a lot of opportunities. This is an innovative county that has a lot of things going on, and just being able to do all the work that is needed. It's one reason why capacity building is so important to us. But in general, no, we've been very fortunate to be able to do important work with great collaboration from all business groups.
And how's the collaboration been so far with kind of external research partners? How has the collaboration been so far with external research partners, academics, and
it's also been great. First of all of our current partnerships, we were lucky to find institutions willing to support us with their own funding, or that had access to external funding that supports their work for us. So we haven't been paying for any of it at all. And second, we've emphasized that any work with us needs to be useful to the county, and that they need to ensure that any ideas that they have, any advice they provide, at the end of the day, it needs to be consistent with decisions that we need to make here. It's not so much to support the general knowledge or an academic goal or a publication on their side, but it needs to have value for us. And they've been very flexible and willing to work with us. We're very happy with the current partnerships, and we're hoping to continue establishing more of those.
Thank you. Did you have a comment or question? You're okay. Okay, I'd love to turn that over to public comment.
Thank you, Vice Chair Lawson-Remer. We have 6 requests to speak on this item, 3 in person and 3 requesting to speak by phone. Also note we did not receive any e-comments on this item. Any members of the public that requested to speak on item 23 by phone, please dial into the conference line using the instructions provided to you. We'll begin with the in-person speakers. All speakers are in opposition. As your name is called, please come forward and stand against the east wall under the murals until it is your turn to speak. I'd like to invite forward Mark, Paul DeBold, and Consuelo. Call your name, please come forward. Thank you.
Hi, Paul DeBold. The agenda sums up data analysis. Quote, when used properly, data can be an invaluable resource for decision makers, giving them clear and objective evidence on which programs and policies work, for whom they work, and in what places and communities. Well, the devil's in the details, and I recommend no on this. The county strategy seeks to ensure we prioritize studies that support important decisions. The report claims that these metrics will provide transparency, but if you prioritize studies right off the bat, that ignores problems which might have hidden value. I do not think that contracts should be made subject to the OEPA director, who apparently wants to prioritize studies before analyzing the data. I strongly urge you to vote no. OEPA is building a cloud-based system to store data. I regard a cloud-based system as less secure than a centralized system in the control of one main user. Systems which transfer data to multi-user facilities run a greater risk of being hacked. They invoke artificial intelligence, which is just algorithms. It's really nothing new. I mean, so don't be deceived. Finally, there are many reputable institutions like Stanford University, which have opinions on all sides of an issue. There are many of which tend to suppress information not in line with policy. We saw a lot of this during COVID, and we are still suffering the effects of parentally.
Thank you. Your time is up. Your time is up. Thank you. Next speaker, please. Your time is up. Thank you. Next speaker, please. Time is up. Next speaker, please.
Mark, that presentation was pure propaganda bullshit. So first of all, the county strategic plan. Strategic and operational goals are UN Agenda 21 hell, literally. And you can see it, it's very clear. Data manipulation, well, Al Gore, he wrote his book, and according to him, our entire country ended like 14 or 18 years ago. So PB is already submerged. What bullshit his data was. But that's what happens when government gets involved. They manipulate data. All governments do this. All governments have propaganda. And it's very obvious, their goals, sustainability, equity. Well, if you want sustainability, you wouldn't just, when our water recently, and this has happened several times, our water aquifers are full, our dams, and they just throw the water away. Now, if they cared about people, they could have a garden incentive program. We'll make your water bill less, and we've got more water than we need. So right now, use as much as you want and grow your garden. We'll give you free organic seeds. They never do any of this. They don't want us self-sufficient. They want us dependent upon them, which is why they have these senior programs and housing programs, even though they won't stop these inequities. Now, this is Rosa, all these are YouTube videos. This is Rosa Corey's title. All these are titles on YouTube. See hers from 3 minutes, 30 seconds. This one, Goodbye American Sovereignty. You can see this from 3 minutes to 6 minutes. The government literally gave control over trade and immigration to foreign unelected counsel. And you can learn more about that. Trump signed it, Biden did not rescind it. Who would do that if they cared about your country's sovereignty? They don't. Here's Sandag. This is Nora working with the UN. At 1 hour and 22 minutes and 50 seconds, she's working with the UN to limit our movement, make it so we can't drive. You can see that, their own meeting. This is all a scam. It's Agenda 21 is our strategic.
Thank you. Next speaker, please.
Great. Yep. Ditto to everything the first two speakers just said. Sustainability, equity, safety, blah, 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 all these beautiful words. Consuelo. All UN Agenda 21. Let's see. The biggest lies ever told to humanity are anything that convinces people they are powerless. It's easy to look at the chaos of the world and think, what could I do? But the truth to that answer is that you could do everything. The truth is, there are billions of good people in the world who really do want best for us all. And there are only a few malevolent forces against it. It still may feel difficult at times to see the chaos of the old systems crumbling, yet the power we all hold is to create beyond that, to see chaos and choose to create beauty, to see the faults and create solutions, to say no to giving in to any attention to fear-mongering ploys and choose to create the more beautiful world we all feel is possible. That is a world without government. This asks for an incredible level of resilience that I know we all have. I don't claim that it's easy, but I do claim that it's necessary. It's time we use the forces of our creative powers to become the change we want to see, and that calls for us to get really good at seeing the chaos and not feeding into it and creating beyond it. So what world do you want to see?
Thank you. Now hear from the individuals that requested to speak by phone. We'll start with our first caller.
It's truth. Hope you enjoyed your 15 minutes to shine. Boo, not exactly a great item to do it on.
I think what I need is some more data. I need to see a table.
Evidence-based government. Where's the laugh track? Does that mean everything you guys passed before was not evidence-based? From the item, quote, across the country, governments are facing rapidly evolving challenges and increasing demand for accountability, end quote. Accountability, we're not seeing it anywhere. We got Hunter Biden in D.C., Gavin Newsom in Sacramento, Tiffany Henyard in Dalton, Todd Gloria in San Diego, the Cardenas in Chula Vista, Sandag somewhere in the region, and many more. This item is proof that little to nothing has been done with evidence or accountability over the last 4 years. If so, the criminal lies would have resulted in a ton of county workers being in prison right now. The Office of Evaluation, Performance, and Analytics is just like the Office of Ethics and Compliance, a joke. Even the OEPA's Virginia-based consultant oozes deception in its name, Impact Paradigm Associates. Data-driven deception is all we've been offered. It's no wonder that NORA has recommended an ethics office for Sandag as if it actually solves the problem. Maybe just put on a good PR face for the people problem that will be exposed soon. And now lying universities are going to be given sole source monopoly contracts at $300,000 a year. Maybe just like with Sandag, UCSD will be given the preferential dirty work. The county's already sharing our info with MIT, the U.S. Office of Evaluation Sciences, and Casey Family Programs. From the item, quote, OEPA is building the enterprise integrated data platform for many of the county's data systems. It will continuously update a master person index, enabling the linkage of individual level data across different source systems, end quote. That's a web, all right. There's inherently no ethics in such a system. So no more tracking of individuals, no more data sharing, no more data collection, and no more policy.
Thank you. Vice Chair Lawson-Remer, that concludes public comment on this item.
Thank you so much. Supervisor Anderson.
Thank you, Madam Chair. I just have a quick question. It was a great presentation. I really appreciate it, and I appreciate the great work. Could you explain why you need a waiver of the policy A87 to be changed? We have checks and balances, and part of the reason why that procurement's there is to make sure that those checks and balances are in place.
Yeah, absolutely. It's mainly due to the complex nature of OEPA's research and evaluation needs. We had conversations with the Department of Purchasing and Contracting, with County Council, and their advice was that we need more flexibility. We still plan to follow a competitive process. It's just slightly different from what's currently allowed under policy A87. But that is the main reason. We need a little more flexibility on designing a competitive process.
And this doesn't change the dollar amount in your department, right? So we're talking about spending the same amount of money. The difference is how you go about it.
That's correct. We have this money in our budget. We're only asking for approval to use it for these contracts.
Thank you.
Well, I'd like to make a motion to approve. Sir. Okay, thank you, Supervisor Anderson. With that, there's a motion by myself, second by Supervisor Anderson to approve this item. Can we please vote?
Vice Chair Lawson-Remer, that motion passes unanimously with all supervisors who are present voting aye.
Okay, thank you very much. We will move on to item number 24. I will speak to this item. I co-authored this with my colleague, Chairwoman Vargas. She's not here with me at the moment, so I'll introduce this item. As we all know, the pollution from the Tijuana River Valley has impacted our communities for decades, including the communities across the South Bay and now communities north like Coronado and up into Point Loma. So we're seeing repercussions of pollution to the Pacific Ocean up the coast as the south swells hit, and along with the unpredictable rains. And this is why we declared the local proclamation of emergency regarding the environmental crisis in June of 2023. Our colleagues at the local, state, and federal levels have also been working very hard to advocate with us to get funding and working to fix and address this dire issue. So this winter, State Senator Steve Padilla introduced a new bill to the California legislature, Senate Bill 1178, the California Water Quality and Public Health Protection Act. It aims to protect our waterways by holding corporate polluters accountable and ensuring that they mitigate their impacts to our communities. So I would like to ask my colleagues to join with me in supporting Senator Steve Padilla's bill to demonstrate that we in San Diego County are really committed to doing everything we can to tackle our environmental justice crisis and our water pollution and water quality crisis here in our region. So with that, I'd love to make a motion and urge my colleagues to support. Second, thank you so much, Supervisor Montgomery Stepp. I will call my colleagues if anyone has any additional comments, and then we will go to the public for any comments. Okay, do we have any public comments on this item?
We do. Thank you, Vice Chair Lawson-Remer. We have 7 requests to speak on this item, 3 in person and 4 requesting to speak by phone. Also note we received 1 e-comment in favor. Any members of the public that requested to speak on item 24 by phone, please dial into the conference line using the instructions provided to you. We'll begin with the in-person speakers. All speakers are in opposition. I'd like to invite forward Mark, Paul DeBold, and Consuelo. I invite you to come forward to the podium. You'll have 2 minutes to address the board. Please state your name for the audio record.
Good afternoon. On its face, big companies disclosing their wastewater discharges sounds good.
I'll ask you to please state your name.
Oh, I thought you knew me. Paul Bold.
Thank you.
On its face, big companies disclosing their wastewater discharges sounds good. Devil's in the details. Why only companies with 2,500 employees or more? Why not just significant discharges? Maybe a leak lasting over a day, discharging waste into the environment and over a certain amount is what you want. I think that just because a company is big doesn't mean that small companies don't pollute. Tagging just large companies sets up another societal divide and makes California seem even less business friendly. And I'm not sure how this partial reporting will really do much for public health. Biohazards crop up everywhere, small companies and large. In fact, smaller companies tend to cut corners more just to save money, and their waste may be more hazardous. And I'm really not sure what this has to do at all with transboundary pollution, by the way. And will we be expanding this to Mexico or even Canada? I recommend a no vote. Thanks.
Thank you. Next speaker, please.
Mark. Well, the question is, whether the people who were making this agenda item were stupid or evil. So I don't think that Nora and Tara are stupid. I actually think they're very intelligent people. Obviously, if you make the corporations pay for the pollution, they're going to charge us, the consumers, on every product they make, and we're going to pay for it as they continue to pollute completely and totally, which is the same thing, incidentally, that's being done with the carbon credits in the name of stopping global warming and gas emissions and greenhouse emissions. Basically, these companies, larger companies that can afford it, have to pay for carbon credits. And Al Gore, by the way, who started all this, is now actually working for the UN. What kind of fricking treason is that? But no one ever calls any of our officials out on any of that. You guys didn't even call out Nathan Fletcher when he was literally a World Economic Forum member, and it said it right on his UCSD presentation. When you look up his name at UCSD. So, you know, I'm not counting on this council or government for any kind of honesty or doing anything right or good. It's too bad because it really needs to be cleaned up and stopped, and the corporations are doing it. And, you know, somebody needs to pay for it, but it's going to be us if you make them pay. They're just going to raise our rates on everything they produce. So, what a worthless gesture. I do not think Tara and Nora are stupid. I will give you that. You're intelligent people. What a totally evil idea. And it happens over and over to us again. You keep finding companies and they just make us pay. Just like the fast food. Now we're paying $10 for a burger, is it?
Thank you. Next speaker, please.
Okay, so Consuelo, more partial, half-assed reporting from government. Again, another waste of time and funds. Penalizing for profit. Let's be real, government could care less about the quality of water. Although water is sacred, and they should, but don't. Instead, they allow for our waters to be tainted with junk, neurotoxins such as fluoride, a natural occurring element, but it's been weaponized by government. Too much fluoride keeps the people docile and submissive. Governments know this. Very convenient. To sum it up, SB 1178 is just more government regulation, more crap to keep the people under their control. Like the majority of government policies, this is just another way to keep the people in line. Their policies never benefit the people. Government policies only ever benefits government. Their policies never benefit the people. Government policies only ever benefits government. Their policies never benefit the people. Government policies only ever benefits the government. Their policies never benefit the people. Government policies only ever benefits the government. Their policies never benefit the people. Government policies only ever benefits the government. For the people in the back, their policies never benefit the people. Government policies only ever benefits the government.
Now hear from the individuals that requested to speak by phone. We'll start with our first caller.
It's true. Here's the part I agree with. Quote, for decades, the pollution in the Tijuana River Valley has impacted South Bay communities and is now impacting San Diego County coastal communities, end quote. You supervisors declared a local proclamation about sewage crisis almost a year ago now, and what has changed? Still nothing, just like I said would happen. No matter how many people from IB testify, it makes no difference to those at the federal government. They enjoy dirty, mucky, toxic, polluting sewage. I mean, they even want us to drink it for the cult of sustainability's sake. On to what I disagree with. People in government have no right to tell anyone how to vote for any proposed bill. It doesn't demonstrate that you take this water pollution crisis seriously. It demonstrates that you latch on and syndicate sync to whatever garbage the state reps throw out. Don't we have enough state garbage polluting our local area as it is? All SB 1178 would do is tax businesses or let big corporations pollute as long as they pay a little tax tribute. What a fraudulent faux solution that is. So, Dorian, I agree that's the same scam as carbon offsets. Until the International Boundary and Water Commission, the federal government, is held accountable and Mexico is held accountable for their heavy pollution, our country is going to continue to be polluted with no end in sight. Why are both of those entities allowed to skirt their responsibilities without punishment? Where are the fines on them? I'd rather see the county sue the federal government and the Mexican government for environmental damages and negative health impacts to our area. Despite all the government refusal to fix the broken infrastructure to finally clean the sewage, I still encourage people to visit Imperial Beach. It's actually a nice place with nice people. And the businesses are open, as Martin likes to say. So I'm going to recommend Oasis Ice Cream, Manolo Market, Trident Coffee, and Luigi's Pizza. Thank me later. And my name is Truth. If you didn't catch it the first 6 times I said it, just for the record's sake, you know, we need to hear it many, many times.
Thank you. Vice Chair Lawson-Remer, that concludes public comment on this item.
Thank you so much. I'll turn to my colleagues. Supervisor Montgomery Stepp.
Thank you so much. I just wanted to bring the Choice Creek watershed into this conversation as well that runs through Lemon Grove, La Mesa, parts of San Diego, and County District 4 and 1 that certainly has its challenges that we hope will benefit from this bill and this action. the source of the pollution must be addressed with the industries that are contributing to the challenges in the watershed, and they certainly must be held accountable. So sometimes that particular watershed is left out of the conversation, but I wanted to bring it into this conversation and say I fully support this item. Thank you.
Thank you so much. Any additional comments from my colleagues? Okay, if not, we have a motion on the floor from myself, seconded by Supervisor Montgomery Stepp. Would you please call the vote?
Vice Chair Lesson-Reamer, that motion passes with Supervisor Anderson voting no, all other supervisors who are present voting aye.
Okay, thank you so much. We are going to be hearing item number 18 next. This is a noticed public hearing, issuance of revenue bonds by the California Municipal Finance Authority for the benefit of Auburn Park 2 apartments in an aggregate amount not to exceed $15 million. Is this CAO, do we have anything to present? Any move to approve? Okay, any questions? Okay, great. Thank you very much. We have a motion on the floor by Supervisor Desmond. We've got a second by Supervisor Anderson. We do need to go to public comment. Can we open the floor to public comment?
Thank you, Vice Chair Lesson-Reamer. We have 6 requests to speak on this item, 3 in person and 3 by phone. Also note we received 1 e-comment in opposition. Any members of the public that requested to speak on item 18 by phone, please dial into the conference line using the instruction provided to you. We'll begin with the in-person speakers. I'd like to invite forward Mark, Paul DeBold, and Consuelo. Please come forward. You'll have 2 minutes to address the board.
From the pictures I saw,
and I'll ask you to state, thank you.
By the way, in case you need a reminder, from the pictures I saw, Auburn Park 2 does not look like it needs $15 million in upgrades. Although I wonder how much debt is remaining on the 2008 financing for this. And how much will we be on the hook for, in addition, considering that the state is pretty broke and probably won't be able to pick up all the funding miraculously. The board seems to be very casual about spending our tax dollars without providing the documents necessary to justify it. Tara, are you listening? Nora called for transparency at Sandag. The pictures showing the present state of the project, if not a detailed explanation of the repairs and why we need to authorize $15 million in bonds on top of what we already authorized, should all be attached in the agenda documents so that the public can examine them without doing a lot of research. I mean, it's really shameful how much people are omitting these days, how transparent you are with the public, you know, how you shift during the meeting, shift items around, you deny us opportunity to speak fully on them. It's really a disgrace. Thanks.
Next speaker, please.
Consuelo, ditto to what Paul just said. This board is casual about spending our tax dollars. Not only casual, but careless. You guys, Nora especially, loves using the word transparency because she's not, and you're not. They're not. Again, they purposely make it difficult for the public to understand. They do not want them examining or researching how our money is spent. $15 million for upgrades. You better provide a thorough list of every penny spent. The majority of the citizens here no longer trust this local government. They're more concerned for what's, this local government is more concerned for what's federally expected of them than what's expected by their own constituents. The past 4 years has proven that. They've managed to destroy businesses and the livelihoods of so many families in our county. They continue to gaslight the people and ignore their pleadings. The people's needs are not a priority of government. Too many, way too many are suffering. The majority don't even know that you guys exist, that this whole entity, SANDAG, this board, they don't even know. And yet, it's incredible how this local government gets away with so much. It's sad. And I'm not going to ever stop showing up.
Thank you. Next speaker. Next speaker, please.
Mark, so there's a statement from your book here on this item. The authority is authorized to assist in financing for nonprofit public benefit organizations or for-profit corporations with a public benefit project wishing to issue revenue bonds, including the borrower. So obviously, I have not looked into whether or not the company doing this, it's a subsidiary of Affirmed Housing Group Incorporated, is profit or nonprofit. But a lot of people don't realize that nonprofit organizations, the CEOs can make thousands, millions of dollars a year. I mean, their salaries can be just incredible. And also, there may be shareholders. I would say there probably are shareholders, perhaps BlackRock, Vanguard, State Street. They own shares in just about everything important in our civilization, much less our government. These videos show the total corruption in our system. This one is on the banking system, the Federal Reserve, and how that works. Your fifth grader could learn it in 15 minutes. I've talked to Monica about it. It starts at 6 minutes and 40 seconds, and you can see it for 17 minutes until 24 minutes. And your fifth grader would understand banking better than most people. This is the corporation nation. Basically, in a nutshell, they've invested us, our parents, our grandparents' tax dollars for generations, and they literally own just about everything around you, including controlling interest in a lot of Fortune 500 companies. They're never going to share any of it with you ever. And this is wealth inequality in America. You should see this video on YouTube. This is all just such a sad scam. A nice idea, but it's corrupted, I'm sure. People making money.
Thank you. We'll now hear from the individual that requested to speak by phone.
Hey, I'm Still Truth, and first I have to point out that Tara has been intentionally delaying the abortion drug item. Anyway, the California Municipal Finance Authority's got more debt bonds to be approved, a cool $15 million for the AHG Auburn Park housing project in City Heights, owned by big developer Affirmed Housing Group, Inc., to approve this rental project. I think they should use some of this money to do Todd's job that he fails at every year.
Fix the damn road.
Remember that lie, Monica? Big developer Affirmed Housing even owns Windsor Point in Carlsbad, suffering from unsafe conditions. That was in item 26 today. The sustainability statement claims that this will be affordable for 55 years. Where's evidence of that? Grocery prices go up every week. And Nora recently said that she never even thought about $7 eggs until recently. Do the realities of the inflation economy cease to exist for her? What privilege must be nice? Let me explain what it's like for us real people. I can't afford those $7 eggs, nor can. Good thing I don't like eggs or eggheads. Today's low income are tomorrow's homeless. And for whoever, because of way more than just Nora, can't see the writing on the wall, it must be nice to live in Fantasyland. Too bad the amusement park is actually closed. Time to exit into the real world and join us regular, non-privileged, hard-working people. So I'm going to recommend not approving this request so we can all just move on with our lives and not accumulate debt anywhere by big corporate developers who build the unaffordable and ugly stagnant tax subsidized by more taxpayer money. But how many eggs can $991 from approval of this item buy? I might need some to throw whenever I hear someone lie about housing affordability. It would hurt less than tomatoes. Although pies are definitely cheaper than eggs and would taste better. And you could blame Paul because he once told me this circus show requires some pies for all the clowns. But can coconut cream pies get through metal detectors? What if I bribe the deputy?
Thank you. Now hear from the next caller.
The person uses the name Audra. Wouldn't it be great if you guys weren't set out to just put us in the biggest debt pile ever and, like, actually did some really good things for the community with all of the money that you guys have and use and throw away? I don't know if you guys use it for toilet paper. I just feel like, I mean, you might as well at this point. It probably have better use than what you're giving it to. But it's funny that you always like to engage with the nonprofits, and you're like, they're the ones that are going to help the community, and they're the ones that are going to, like, make things better when it just goes into their CEO pockets, just like Mark was saying. And it's like, you know, I mean, but how cool would it be if, like, you guys actually did something that was, like, beneficial to the community? I mean, that would be pretty cool. Like, it would be neat if we took all these millions and billions of dollars and actually turn things around. But it's like, it's crazy because that's not the plan, right? I mean, the plan isn't to make things better. The plan is to line pockets of, you know, special interests and all these, you know, really wealthy people just to pretend like we're doing something here to really help. So it's just, you know, like I think about the days when, like, things could be turned around and, like, you know, when the people are ready, that's going to happen and you guys are going to be out of there because there is no point in having you guys destroy everything. We actually need to rebuild. And that's what's going to happen. You guys aren't going to be a part of that because all you guys do is tear up the sandbox. It's like somebody builds a sandcastle and you go over there and you kick it over. It's actually really sad, but I mean, you're doing your job, right? I mean, you're getting pretty pennies to do it. Just letting this invasion happen, it is so. Wait till something happens, and it already has, and that's the sad thing is you guys know it, and you're facilitating it because all you care about is total destruction, complete and utter destruction of the county of San Diego. And then you know what happens after that? The rest of the nation falls. So good on you guys for, like, facilitating that. At least there's.
Thank you. Vice Chair Lawson-Remer, that concludes public comment on this item.
Thank you so much. So we have a motion by Supervisor Desmond, a second from Supervisor Anderson. Could you please call the vote?
Vice Chair Lawson-Remer, that motion passes unanimously with all supervisors who are present voting aye.
Great, thank you so much. So we'll move on to our last item today, which is item 21. This is ensuring continued access to medication-based abortion treatment for San Diegans. This is my item that I brought to my colleagues. I brought this here for consideration by the board today because the Supreme Court's decision to overturn Roe versus Wade in 2022 was just the start of rolling back legal protections and the federal right to access abortion. We have states where abortion is outlawed, where there's news stories on a regular basis about cases of childbearing individuals not being able to receive safe and effective reproductive care, and really coming near death because of this denial of fundamental reproductive choice. With this particular case regarding mifepristone, we see a well-tested, FDA-approved course of treatment threatened at the federal level, which could impact even states such as ours that have expanded access to abortion, such as California, which could impact us locally in San Diego. Mifepristone has been on the market for over 20 years. It's a widely used, safe form of treatment that not only terminates early-stage pregnancy, but is also often utilized for those suffering pregnancy losses. We heard from one of the Supreme Court justices in the oral arguments on March 26 about how she personally had utilized mifepristone in her previous pregnancy losses as a safe and effective treatment. And for individuals in rural areas where it is difficult to access clinics or medical providers, access to mifepristone and medication-based abortion treatment has been a vital, vital game changer. So that's why I brought this item here today. Because while oral arguments certainly seem promising for continuing access to mifepristone at a federal level, we cannot be apathetic, and we need to be proactive and aggressive about ensuring that our local access to reproductive health is guaranteed. So the purpose of this item is to ask staff to proactively create a plan here at the county to ensure that citizens within San Diego County are able to access reproductive health care, such as mifepristone, and to be an active ally and advocate for our local providers, clinics, and telehealth providers to ensure that we across San Diego County continue to be able to provide patients with reproductive health care, and that we in San Diego County and women in San Diego County continue to maintain access to imperative medication within our communities. So I would certainly appreciate the support of my colleagues on this item today, and with that I'd like to make a motion. We will hear first from any of my colleagues who want to comment, and then we'll turn to public comment. Supervisor Montgomery Stepp.
Thank you, Vice Chair, for bringing this forward. I will second the motion with the recent actions that have been taken throughout our country to limit access to reproductive care. I want to emphasize the importance of preserving the right of individuals to choose what is right for them and their bodies in California and in the County of San Diego. This is ultimately an issue of liberty and freedom of choice. Denying access to these medications not only infringes upon bodily autonomy, but also perpetuates social and economic inequalities. And as is often the case, these inequalities disproportionately affect marginalized communities who continue to face significant barriers in accessing healthcare services. We must do what we can as a county to ensure barriers to healthcare are being removed and not allow more barriers to be established. By ensuring a safe access to safe, established medical treatments, we can protect the health and safety of countless San Diegans who help empower them to work with their healthcare providers to make informed decisions about their reproductive health. I am fully in support of these recommendations, and I thank you again, Vice Chair, for bringing this forward. I did at the beginning. But yes, it is.
Thank you. Apologies. Do we have any other comments, or just we'll go to the public? Okay.
Thank you, Vice Chair Lesson-Reamer. We have 11 requests to speak on this item, 5 in person and 6 requesting to speak by phone. Also note for the record that we received 61 e-comments, 57 in favor and 1 in opposition. Any members of the public that requested to speak on item 21 by phone, please dial into the conference line using the instructions that were provided to you. We'll begin with the in-person speakers, starting with those that are in favor, followed by those in opposition. I'd like to invite forward the speakers in favor: Samantha Schwimmer, Lorraine Esgate. Not seeing any movement in the chamber. I'd like to invite forward the speakers in opposition: Mark, Paul the Bold, and Consuelo. We'll have 2 minutes to address the board, and again, please state your name for the audio record.
If you don't remember me, I'm Paula Bold. Tara mentioned or reminded us that Roe v. Wade was passed in 2022. Why was this not done then? Given the alarming side effects of these medicines, we need a better alternative than just medicines. The board letter and resolution should mention the importance of non-medicinal treatments. This letter mentions mifepristone and misoprostol. Mifepristone side effects: abdominal or stomach pain or uterine cramping, back pain, diarrhea, dizziness, headache, nausea or vomiting, heavy bleeding including blood clots, sour stomach, anxiety, belching, cough, fainting or lightheadedness when getting up, anxiety or fever, flu-like symptoms, headache, heartburn, increased clear or white discharge, vaginal discharge, indigestion, itching of the vagina or genital area, lack or loss of strength, let's see, pain during sexual intercourse, pain or tenderness around the eyes and cheekbones, pale skin, shaking, chills, stomach discomfort, upset or pain, stuffy or runny nose, tightness of the skin, shaking, chills, stomach discomfort, upset or pain, stuffy or runny nose, tightness of the skin, trouble sleeping, trouble breathing, exertional.
Thank you. Next speaker, please.
On and on. Thanks.
Final call for Mark and Consuelo.
Wow, Mark, what a stunning list of side effects. I had no idea. So first I want to say that I do not want government involved in people's personal business on this level at all. I'll say that again. I do not want government involved in any way on people's personal level on decisions like this. That being said, terminates early stage pregnancy is a nice term for murder. And now a lot of people would say, oh, well, we've got debates about whether we're pro-life or whatever. The point is, if it were you being aborted, there's not one person that believes in it, not one single person. As long as it's not you, it's okay. And there's no one to speak for the children, for the babies. So now again, I'm not for government stopping anything. It's just too much control. But let's call it what it is. It's a mother murdering her own child. It's really sad that we have a system where people are so afraid of being in poverty or being lonely or whatever, a myriad of things, that they would even consider that. But evidently that is the society that government has created. So I can't believe the list of side effects Paul just listed. That's stunning, and I'll bet most people taking the pill have no idea. They're probably just rushing to get it and get it down their throat as quickly as they can after they had unsafe sex. So anyway, what can you say about it? Government shouldn't be involved either way. You shouldn't be paying for the abortion or the pill either.
Next speaker, please.
Consuelo. So, yep, the government has no business being involved with health, reproductive, or anything else. How did we get here? We got here by people not paying attention, but they're not paying attention because they're stressed, because that's the design, because we have to pay taxes and we have to do all this stuff, and that's, I could be here for years. I'm not here to judge anyone, but I will just say and remind you all that you all are here, and that is the result of your parents not having an abortion. Yeah, that's all I got.
Yeah. We'll now hear from the individuals that requested to speak by phone. We'll start with our first caller.
Hi, good afternoon, Supervisors. My name is Samantha Schwimmer, and I am the chair of the board of the San Diego Coalition for Reproductive Justice, although I speak as an individual. I'm here today to urge the board to ensure continued access to medication-based abortion treatment for San Diegans. As a trained abortion doula, I have seen firsthand the importance of safe access to abortion medication. This is especially true in parts of our county where folks don't live in close proximity to an abortion provider. Medication abortion allows people to have safe abortions in the comfortable environment of their homes. With fewer side effects than Tylenol and Viagra, medication abortion is an essential reproductive health option. We know that when abortion access is restricted, this has the biggest impact on BIPOC, queer, and low-income communities. And taking steps to ensure supply of medication abortion is in line with the county's commitment to equity. Beyond abortion care, mifepristone is also recommended by medical experts such as the American College of Obstetricians and Gynecologists as part of the superior medication treatment regimen for miscarriage care. With increasing restrictions on abortion care, we have seen an increasing need for reproductive care in the region, and I commend the board and especially the vice chair for bringing forward this critical item and taking this step to protect abortion access in our county. Thank you so much.
Thank you. Now hear from the next caller.
That person uses the name Audra. It's crazy how we condone murder, right? And it's like these children are getting the death penalty right off the bat without even ever, having a chance at life just because someone feels they made a mistake because they were careless. And, other things tend to happen, but every life is valid and every life matters. But yet here we're, deciding that some do and some don't. And it's no wonder why you don't care about the children that go missing from the border invasion or the ones that are, trafficked and, sold off with their organs or, just sex slavery. And so that every orifice in their body can be penetrated. Obviously you cared about children, then you would care about all children and not say that, some have, a justification for living while others don't. So it's sad to see that we can condone these things, but it just shows you the state of the world that we live in, where, you can just take a life, doesn't really matter. We can exploit people, doesn't really matter. We can have children sit there and, mutilate their bodies because it's good for them, right? To just have a lifetime of suffering ensue because it's, something that's always going to, be destructive to their life, especially when they have infections all the time. So it's just funny to see you talk about acting like you care about someone and, preserving their life. But in order to preserve their life, you're willing to take another life. So it just shows you how upside down everything is, and you don't care about life if you can do that. But, that's just what you guys do, and you try and virtue signal like you're just so fantastic and you're helping people, but on one hand, you're putting somebody 6 feet in the grave. And, you should be thinking about that and how that would be if it was you or somebody you knew, if they just didn't have a chance and you just decided that they had to go. So that's the thing.
Thank you. And I hear from the next caller.
Hi, my name is Lorraine Escate. Thank you, board, for having me, and thank you, Supervisor Reamer, for putting forth the ensuring medical abortion access. It seems like a lot of callers are confused as to what abortion is. Abortion is reproductive health care. So if someone has a miscarriage and there is fetal tissue still in their uterus, they have to have an abortion, it's usually called a DNC, in order to live. Like this person with the uterus will die if they don't have an abortion. So I just feel like that's very important to put out there. It's not always just like choosing whether or not you want to have a baby. It's literally healthcare. So as far as accessibility, medication abortion offers a non-invasive and accessible option for individuals, especially those in rural and underserved areas who may have difficulty accessing surgical abortion services. It allows individuals to manage their reproductive health in the privacy of their own homes, maintaining their autonomy and decision-making without the need for invasive medical procedures. This medication abortion has been shown to be safe and effective when administered correctly with very low risk of complications, making it a reliable option for many individuals. It can be used in the early stages of pregnancy and on. It's incredibly effective. It's incredibly safe. It offers few risks, flexibility, and basically just empowerment and being able to take control over your own body in your own home. Whether it's for medical reasons or not, it's really none of our business. And, you know, it literally saves people's lives. So anyway, I appreciate your time. Thank you so much.
Now hear from the next caller.
Truth, abortion is the death of a baby. And there is no such thing as a federal right to access abortion. Read the Constitution, it's not in there. The Declaration of Independence does reference an unalienable right to life, though. Many have an issue with this drug, mifepristone, because it's used misoprostol to kill babies past the embryo stage at the late end of birth. And it's important to note that no studies upon the drug mifepristone have been done to determine whether or not it causes cancer, but it has definitely resulted in some deaths of women who've taken it. Mifepristone was invented in the 1980s by the company Rousseau Ucla, and they wanted to discontinue it, but the French government forced its production. In 1994, the company then donated all rights to the drug to the Population Council in exchange for immunity from liability. This council was founded by John Rockefeller, a racist eugenicist dedicated to eradicating those he found unworthy of life, the same goal that Margaret Sanger, founder of Planned Parenthood, had. The Population Council then gave it to New York-based Danco Labs, which only has a P.O. box and does not disclose any of its board members, big investors, or big profits. This company even had this drug approved via a secret meeting with the FDA. Last year, Danco Labs paid out $765,000 with interest to the U.S. government to settle a lawsuit that alleged that from 2011 to 2019, they failed to properly label their drugs being made in China, skirting customs duties and checks. Then, just a couple of days later, Biden suspiciously said that abortion-causing drugs need to be protected. Why? Politicians are scared they'll lose their abortion pill when this money trail is all exposed. W. Bradley Daniel, La Jolla-based Joseph Pike, who later pled guilty to a forgery charge, Greg Hawkins from Solomon Brothers, Biofarm Investments, Shiroyama LLC, and even the generic mifepristone maker Gin Biopro has a big contract with Planned Parenthood South. There's big money in.
Thank you. And Vice Chair Lawson-Remer, that concludes public comment on this item.
Okay, thank you very much. Supervisor Desmond?
Thank you, Madam Chair. Appreciate it. It's a difficult subject, but I don't really think, the board letter is about pro-choice or pro-life. It's really about access to this misoprostol pill?
Mifepristone.
Okay, but the one that's misoprostol.
Misoprostol.
It's more about access to the misoprostol pills. The county, we got nothing to do with the management of pills. And as this board letter states, however, the state does, when it comes to abortion, they have the authority over abortion, not the county. And as this board letter states, that the state itself has already stockpiled 2 million misoprostol pills. And I think it's very unlikely that this medication is ever going to be restricted in California. And again, the county has nothing to do with the management of these pills. I think these pills are going to be accessible. We got 2 million extra ones sitting at the state. And if that were to get low, then maybe this board letter, but I'm not going to be supporting it now. Thank you.
Okay, thank you very much. We have a motion by myself and a second by Supervisor Montgomery Stepp. Could you please call the roll? Just vote. Apologies.
Vice Chair Lawson-Remer, that motion fails with Supervisor Desmond voting no and Supervisor Montgomery Stepp and Vice Chair Lawson-Remer voting aye. Fails due to the lack of required affirmative votes.
Okay, thank you very much. At each meeting, I ask if anyone would like to provide a brief update, a report on progress, or share pertinent information regarding boards that everyone sits on. So if anyone has a board committee report. Okay, great. Now it's time for non-agenda public comment. Clerk, can you please call the remainder of the public speakers?
Thank you, Vice Chair Lawson-Remer. We have 16 remaining requests to speak on matters not listed on the agenda, 7 in person and 9 by phone. Any members of the public that requested to speak under non-agenda public comment by phone, please dial into the conference line using the instructions that were provided to you. We'll begin with the in-person speakers. I'm going to go ahead and call all the speakers because it doesn't appear that all the individuals are here in the chamber. So if your name is called, please come forward and stand against the east wall under the murals until it is your turn to speak. You'll have 2 minutes to address the board, and I'll ask you to please state your name for the audio record. I'd like to invite forward Yusef Miller, Grace June, Andrea St. Julian, Deanna Cerna.
She's not here.
Cheryl Canson.
She's not here.
Okay. Michael Brando. Mark. Paul DeBold, and Consuelo.
My name is Yusef Miller, North County Equity and Justice Coalition, and we just recently lost Paul Parker. He resigned from the CLRB, and in our search for a new CLRB executive officer, we need someone who has the initiative and forward-thinking and reform-minded as Paul Parker was. We made a lot of leaps and bounds in the time of Paul Parker's time at CLRB, and with that being said, the CLRB has received some reform data from the University of Ohio, which really will transform CLRB into a really useful entity, more useful than it is now. It's been doing some great things, but there's 68 points that the CLRB has choose to accept. And I think the Board of Supervisors as well. But the CLRB is deciding to give this piecemeal to the board. I suggest that the board please ask for all 68 immediately. Don't allow them to send 3 or 4 at a time, because what that will amount to is about 2 years before you even get all of those 68 in hand. And then that will delay CLRB reform even more. This reform is beneficial to not only the people who are affected by the Sheriff's Department, but also the sheriffs themselves and the way that we investigate issues that happen in custody. So please demand that the CLRB submit all 68 of these points at one time and not piecemeal it over 2 years, because 2 years will turn into 3, 3 years will turn into 4. Please don't allow that to happen. Thank you.
Chair, can I just ask the speaker a question? Are you on CLRB now?
Am I on CLRB?
Yes.
I am not. No.
Okay, thanks.
Okay.
Thank you. Next speaker, please.
Good afternoon, honorable board members. My name is Andrea St. Julian, and I am co-chair of San Diegans for Justice. In 2022, San Diegans for Justice submitted to this board a 97-page report we had commissioned on the strengths and opportunities of CLRB. The report was prepared by Sharon Fairley, a law professor at the University of Chicago and one of the foremost experts on civilian oversight of law enforcement in the country. She was responsible for creating and building Chicago's Civilian Office of Police Accountability. San Diegans for Justice commissioned this report because of residents' extensive complaints about the functioning of the Sheriff's Department and grave concerns about local jail deaths. The San Diegans for Justice report produced a list of 70 recommendations that would allow CLRB to advance, modernize, and become more effective. We urge this body to consider all 68 of those recommendations that were approved by CLRB itself. We also urge this board to consider all 68 of these recommendations immediately, and as Yusef Miller has discussed, not on a piecemeal basis. In order to modernize and advance CLRB and to allow it to fully realize its mission, it must be allowed to increase and expand as recommended. And as a matter of fact, Yusef Miller should be on CLRB. And I hope that one of the supervisors nominates him.
Thank you.
Thank you.
Next speaker, please.
Mrs. Gerald. Hello, my name is Grace John. I am a local civil rights attorney here in San Diego. I have the privilege of representing a number of family members who have been impacted by the deaths in custody at the Sheriff's Department, including the family of Elisa Serna, the family of Michael Wilson, the family of Omar Moreno, the family of Paul Silva. And I come here today on their behalves. It's pretty onerous to spend a day waiting to address the Board of Supervisors, but I am so pleased. I'm so pleased that I have the opportunity to do so, and there's one thing that I wanted to highlight. In 2022, in February 2022, the state auditor actually issued a scathing report about the conditions at the Sheriff's Department. I'm sure you're all familiar and aware of it. It was so terrible that Sheriff Gore had to resign almost immediately. That that state auditor's report also took CLRB to task, saying that CLRB had to become more aggressive and expand its jurisdiction over medical personnel at the jail. CLRB has since passed that resolution. It should be coming to the board, hopefully in the coming months, and I would urge the board to approve that so that jurisdiction, CLRB's jurisdiction, can be expanded to include medical doctors and nurses at the jail. There's one other thing I want to just mention. I hope that the county board will consider transforming CLRB into something more like the Inspector General that is apparent in the federal government. So the federal government, whenever there is a use of force incident or a allegation of misconduct against a federal law enforcement agency, such as Border Patrol, CBP, there is an Inspector General, an independent Inspector General that can come in and do a very thorough and exhaustive review with multiple recommendations for improvement. If you look up the case of Anastasio Hernandez Rojas, who died in San Ysidro, you'll see what I mean. Thank you.
Thank you. Next speaker, please.
Paul LeBeau, do you know me? Today I'd like to talk about our 11th president. After the comedy duo of Tippecanoe and Tyler 2, there was James Knox Polk. He was the only president to deliver on all of his campaign promises. You might want to listen. And you know how he did it? Kept it simple. He did not kowtow to everyone, no kissy ass. These are his 4 promises. End the dispute with Great Britain over the Oregon Territory, that is the Northwest United States, reduce tariffs from 40%, reestablish an independent treasury, acquire California from Mexico, and actually he ended up getting the entire country west of Kansas. He also promised to serve 1 term, which he also did. You, on the other hand, want to serve more, whether us or other interests, like the state or big money, and make so many promises that we, perhaps even you, lose track, although we know a lot have failed but get re-promised anyway. Some of you promise so much BS to so many people that a lot of it is literally broken down to crap by the time they do it, like the sewage crisis. Hey, I hear you're addressing the housing and homeless crisis. Would this be, by the way, like the Gettysburg Address? Anyway, thank you.
Next speaker, please.
Consuelo. So I had something set to say, but I'm just going to talk about how this meeting went, how this meeting is being conducted, especially today, combining agenda items, the chair not looking at people who have waited all day just to speak on non-agenda, and yeah, it's so pathetic. Extension of lunch times and just, you know, you have absolutely no regard for the people's time or what they have to say. You know, you don't care that people do take time out of their lives to research and address and come here and to, you know, speak up on, you know, their concerns. It's like, it's so sad. It's freaking pathetic, man. There has to be some kind of like Robert's rules you guys went against, or the the Brown Act with combining items, shortening times. I mean, it's just, yeah, it's, anyways. It's not what I was going to say for my non-agenda, but it's just, it had to be addressed because you guys are so disrespectful. Rules for thee and not for me. And yeah. Yeah, that'll never happen because they want the people to wait, but it's so good. So.
Next speaker, please.
Mark, between October 2019 and January 2024, there were over 9.8 million border encounters across the country, 3 times more in the past 5 years than our 2.86 million active military personnel. In 2022, there were over 2.2 million cases registered by the U.S. Border Patrol, marking an all-time high for illegal border crossings, and more than 371,000 in December 23. Unlawful border crossings of Venezuelans into the U.S. reached record high levels in 23, with more than 262,000 nationwide encounters registered until August. That is 44,000 more than our entire California active military in 1 year, and Venezuela is a communist country. The Border Patrol reported nearly 6,000 encounters from Chinese citizens at the southwestern border in December 23, up from around 900 in December a year earlier. 6,000 Chinese per month will surpass our California military in about 3 years, as Venezuela has done in 1 year. Most U.S. adults say U.S. immigration is either a crisis, 45%, or a major problem, 32%. Considering these staggering stats, and that a top Pentagon official said ISIS-K could attack the U.S. in 6 to 12 months, you supervisors are in a national emergency. AR-15s are not weapons of war. Tara, Monica, Nora is gone. What could be greater treason than not closing the border to migrants for now, and to issue military-grade weapons to all citizens, as Switzerland has done? No answer? I can't think of any greater treason either. And Newsom and Biden should be tried in the Supreme Court. We are sovereign citizens, not the North American Union. Real leaders and $10,000 per month consultants would warn and save people. Worthless tyrant supervisors are destroying us. I'm not paid $200,000 per year. No more kings. This is an emergency. We're being overrun. We could be attacked.
Thank you. We'll now hear from the individuals that requested to speak by phone. Start with our first caller.
And your 10-round clips won't save us.
My person uses the name Audra, so I wonder how many people know that the Catholic Charities Diocese is the main facilitator of all of this human trafficking, especially here in San Diego. They got $74+ million from FEMA, and FEMA only gave out $350 million to the nation, and we got almost $75 million of that just to facilitate all of this. And it's funny because they don't want to talk about human trafficking, but the Catholic Church is actually now bankrupt and filed for bankruptcy because of pedophilia and allegations of sexual assault. So here they are trafficking more children to abuse more children, and they keep getting money flooded into their pockets to help facilitate this invasion. And it's really sad to think that, you know, Border Patrol agents are being asked to do what they never have been told to do before, which is release pedophiles, murderers, rapists, you name it, onto the streets of San Diego. And you guys sit there and you ignore it and act like, again, that this is a humanitarian crisis. You're right, it is, but not in the way that you guys say. And Jim, why have you never gone to those hotels where they're holding the children? All you want to do is go to the Iris Transit and be like, oh, look at this. Oh, my gosh. There's way more going on under the people's noses than people even know about. And you guys are facilitating it. You're putting our nation in danger, even our communities, and you don't care. And you're helping give them money because you want to give all of these NGOs all the, money to do all of these things, but they're the ones destroying the county by allowing this to happen. And where are the 500,000 children that have gone missing? Do you care about kids? You act like you do, but I guess you don't because you want to abort them. But so maybe that's why it doesn't really matter where these kids rent, right? It doesn't matter if they're like a sex slave and if their organs have been harvested. It doesn't matter, right? Because they don't matter, right? Because if they did, you guys would do something, and we wouldn't allow thousands of children to disappear from the convention center. You guys know where they went? Nope. Do ya? Do you even care? Why don't you act like it?
Now hear from the next caller.
Thank you. My name is Megan Stewart, and I'm a public health professional. As we celebrated National Public Health Week last week, I would like to share some facts with the board regarding marijuana and lung health. The National Institute of Drug Abuse reported that marijuana smoking is associated with large airway inflammation, increased airway resistance, and lung hyperinflation. And those who smoke marijuana regularly report more symptoms of chronic bronchitis than those who do not smoke. The American Lung Association is also concerned about the health impacts of marijuana use, especially on lung health. They strongly caution the public against smoking marijuana because of the risk of damage to the lungs. Research shows that smoking marijuana causes chronic bronchitis, and marijuana smoke has been shown to injure the cell linings of large airways. Tragically, we are witnessing firsthand the devastating consequences of marijuana use among our youth and young adults. I know personally of a case involving a 24-year-old individual who was a user of alcohol, nicotine, and marijuana since his college years. This individual unfortunately experienced a collapsed lung this previous week, requiring urgent hospitalization and placement on a breathing apparatus. He is now in recovery, but has actually shown symptoms of his other lungs starting to collapse. We should strive to prevent stories like this. The rising incidence of lung collapse and failure among our young adult population is alarming and demands immediate attention. As stewards of public health and safety, it is essential for us to address this pressing issue and enact measures to mitigate the detrimental effects of marijuana use on our community's well-being. Thank you so much for your time and consideration.
Thank you. Now hear from the next caller.
Good afternoon, Supervisors. My name is Becky Rapp. I'm a parent and a public health educator focused on the harms marijuana products pose to residents. I'd like to bring to your attention a recent investigation uncovering evidence that consumers of pot products sold at permitted pot shops are not being protected, specifically from banned pesticides. The public has been told the lie that by permitting marijuana products, they could count on them being safe to consume. According to the San Francisco Gate investigation, numerous problems plague the state's pesticide rules, including labs falsifying safety tests and stores selling pot contaminated with banned chemicals. When the DCC, or California Department of Cannabis Control, was contacted regarding the lethal concerns, they admitted that they're currently unable to test for pesticide contamination in some pot products. Pesticides pose a significant problem to the marijuana industry. While most farmers can rely on federally funded research and regulations around the use of toxins to keep bugs away, little of that research looks at the safety of actually smoking the residue left behind by pesticides. It's crucial that our county move to bring attention to this issue by holding the industry accountable for products being sold. Please consider better regulating the current market before expanding and increasing the dangerous situation these products are posing, especially as the DCC has admitted to not being capable of properly regulating. Thank you.
Thank you. And Vice Chair Lawson-Remer, that concludes the request for non-agenda public communication this afternoon.
Okay, that concludes the business before our board today, and with that, session is adjourned.
Thank you. I'll just note for the record for members of the public that item 27, which are closed session matters, will be continued to tomorrow's session. We'll take public comment on closed session matters tomorrow.
Jim, I saw